Mr. Chair and council members, we are now live.
Modesto?
Yes, council chair and council members and participants, we are now live.
Good morning, everybody. Welcome to the Committee of Public Health and Human Services. I understand that state law currently requires that the following announcements be made at the beginning of every remote public hearing as follows. Due to the current public health emergency, city council committees and currently meetings remotely. We are using Microsoft Teams to make these remote hearings possible. Instructions for how the public may view and offer public testimony at public hearings of council committees are included in the public hearings notices that are published in the Daily News, the Inquirer, and the Legal Intelligencer prior to the hearings, and can also be found on phlcouncil.com. I note for the record that the hour has come. Sabrina, who is our clerk, would you please call the roll and take attendance? Members that are in attendance, would you please indicate that you are present when your name is called? Also, please say a few brief words in responding so that your image will also be displayed on the screen when you speak. Sabrina, would you please call the roll?
Councilmember O.
Good morning, Chairman and colleagues. Glad to be at this hearing.
Councilmember Gim.
Good morning, Mr. Chairman. Good morning, council colleagues, and good morning to the public.
Councilmember Green.
Good morning, Mr. Chair. Good morning, colleagues. Looking forward for an engaged conversation today on these important issues.
Councilmember Thomas.
Good morning, Mr. Chair. Good morning, colleagues. Good morning to the listening public.
Councilmember Brooks.
Good morning, Mr. Chair. Good morning, colleagues. Good morning, listening public.
Chair Bass will be joining us later on, and Chair Heenan.
I am present. Thank you. Thank you. A quorum of the committee is present, and this hearing is now called to order. This is a public hearing of the Committee on Public Health and Human Services regarding bill numbers 200-678 and 210-122. Sabrina, will you please read the title of these bills?
Bill number 200-678, amending Chapter 6-200 of the Philadelphia Code entitled Preventive Medicine by imposing duration limitations on emergency control measures, requiring council approval of emergency control measures in certain circumstances, and to make technical changes, all under certain terms and conditions. And Bill number 210122, amending Section 9-4116 of the Philadelphia Code entitled Public Health Emergency Leave to establish leave time for public health emergencies and modify existing provisions concerning the paid sick leave and make technical changes, all under certain terms and conditions.
Thank you. Before we begin testimony from the witnesses we have here today, everyone who has been invited to the meeting to testify should be aware that this is a public hearing and this hearing is being recorded. Because the hearings are public, participants and viewers have no reasonable expectation of privacy. By continuing in the meeting, you are consenting to being recorded. Additionally, prior to recognizing members for the questions or comments they have for witnesses, I will note for the record at this time that we will use the chat feature that is available in Microsoft Teams to allow members to signify that they may wish to be recognized. In order to comply with the Sunshine Act, the chat feature must only be used for this purpose. Before I call on the clerk, for the first panel, would any of my colleagues and fellow committee members like to make any opening comments?
Chairman, I would like to make an opening comment on Bill 200678.
You may. Chair recognizes Councilmember O.
Thank you very much, Chairman. I am going to take a little bit of time to frame the issue and the discussion so that we can all be very clear about what it is. So let us start with March 6th of last year. That is when Governor Wolf issued his proclamation of disaster emergency related to COVID-19. And when he did so, he suspended the provisions of any regulatory statute prescribing the procedures for conduct of Commonwealth business or orders, rules or regulations of any regulations that would in any way prevent, hinder, or delay necessary actions in coping with this emergency. The governor through his emergency team and through his Secretary of Health is empowered by law to do for the Commonwealth, including the city and county of Philadelphia, all that is required for the health and safety of its residents and citizens. Following that, the mayor of Philadelphia on March 11th issued a declaration of extraordinary circumstance related to COVID-19. And in that, he suspended the requirements of Section 8-407 of the Home Rule Charter, which allows the temporary promulgation of regulations pertaining to the threat of the spread of COVID-19. The governor issued a emergency proclamation, and the mayor followed with a declaration of extraordinary circumstances. When that is done, the normal process of governance is suspended to deal with the emergency. What we are dealing with is not a suspension of the governor's powers. The Commonwealth has the power, and the city and county of Philadelphia is subject to the regulations issued by the state. However, my bill amends the city law, which only applies when it deviates or differentiates itself from the Commonwealth or the governor's orders. So let's start with how the city of Philadelphia has this power. It's in the charter, but it's granted by the state. In particular, under Section or Title 35, Health and Safety, Section 7501, General Authority of Political Subdivisions, establishing emergency management organization. Each political subdivision of this Commonwealth is directed and authorized to establish a local emergency management organization in accordance with the plan and program of the Pennsylvania Emergency Management Agency. The next subsection, Declaration of Disaster Emergency. A local disaster emergency may be declared by the governing body of a political subdivision upon finding a disaster has occurred or is imminent, the governing body of a political subdivision may authorize the mayor or other chief executive officer to declare a local disaster emergency subject to the ratification by the governing body. The declaration shall not be continued or renewed for a period in excess of 7 days, except by or with the consent of the governing body of the political subdivision. Any order or proclamation declaring, continuing, or terminating a local disaster emergency shall be given prompt and general publicity and shall be filed promptly with the agency. And it basically says that if the local emergency or health board or health department is unable to provide the health care that the state requires, the state has the authority to come in and supersede it. Now, that is the Disease Prevention and Control Act of the Commonwealth of Pennsylvania. The reason I bring that up is because when the mayor declared his extraordinary circumstances, he suspended Section 8-407 of the charter. And that states that every department, board, and commission is hereby empowered to make such reasonable regulations as may be necessary and appropriate in the exercise of its powers and performance of its duty under this charter or under any statute or ordinance. The Department of Records shall give public notice of such filing by advertising in 3 daily newspapers, and a person affected by those regulations may request a hearing. And subsection C says this in particular: if any person affected shall present to the Department of Records a written request, therefore he shall be afforded a public hearing before the department, board, or commission promulgating the regulations and the city solicitor. Those regulations, those rules that give the public an opportunity to be heard on the promulgation of regulations that affect them is suspended. It's not being done. What we are talking about is COVID-19 regulations that have been in place in this city that go beyond, that differentiate from the requirements of the state Secretary of Health and the Commonwealth of Pennsylvania in regards to Philadelphia. And in particular, the fact that after a year, there is a lot of confusion, frustration, and anger about the lack of transparency and accountability of what is happening in this city. Having accountability is not something that interferes with the Department of Health. They do not need to come before this body for everything that they do. But after a year, and if this bill passes and becomes law, another 90 days, they must come before this body to report what they've done, how effective it's been, and what their plans are in the future in order to get an extension of their emergency powers. Right now, the health department and the city administration is saying basically that they have unlimited time and unrestricted power to decide what they will do, when they will do it, and how long they will do it, regardless of what the public feels about it. Because of the suspension of the regular process, even council is left out of impacting, influencing, or questioning to its satisfaction what has been going on this past year. One of the challenges that has occurred is that we cannot get answers from the administration and from the health department. The briefings are inadequate. The answers are inadequate. I do not know, and I don't know there's any council people who know, and I don't think the public knows what is going on with the distribution of vaccines. When the health department prohibits gatherings in religious places like churches, synagogues, mosques, and others, in contradiction to the CDC guidelines, in contradiction to what the Commonwealth has done, when it restricts people's gatherings, it affects everything from people having family time, from people being able to go to school, go to work, from people able to shop. So one of the issues that has arisen is in order to get people back to their livelihoods where they can feed their families, have health care, buy food, put it on the table, take care of their living situations, pay their rent, is the vaccinations. There are restrictions. The answer is vaccinations. But what has been done over these past months, and we don't have an answer. Philly fighting COVID is a bizarre, unanswered situation that we are not being informed of, other than the people in charge don't know what happened, they weren't there, they weren't paying attention, or something. I don't think that the health department and the administration can police itself, can make itself transparent and accountable, because the people are demanding the answers. When the vaccine is not distributed, people suffer, people die. And when the vaccine is not distributed equitably, certain people who get vaccinated can go back to life, perhaps. But in many of our poorer and underserved communities, in many of our minority communities, immigrant communities, and senior communities, they're not able to get the answers of what's happening. They need the vaccine in order to get back to a life, a quality of life that they deserve. We don't know why Philadelphia has restrictions different from Delaware County, Bucks County, Montgomery County, Chester County, and what the effects are. What I can say is Pittsburgh, which is the other big city in our state, has a population of 1,200,000 people. We have a population of 1,500,000 people. And they have a mayor who goes before city council to get extensions of the emergency declaration. They have not denied those emergency declaration requests by the mayor, but he is working with city council, and they are the elected officials that are accessible to the community. They are able to explain what's going on. They are able to explain what's going on with the contracting. I don't understand what's going on with the contracting. Things have been suspended and we don't get answers. I think it is important that rather than have what I believe are rather not satisfactory briefings, because we don't have any power. There's nothing we can do to ensure that we get answers. There's no power that we have. And I think the people demand that we step in and act on their behalf. Let me just say that Mayor Bill Peduto, he's a Democratic mayor of a city with a Democratic council. They cooperate, they work, they're informed. They've extended the declarations, and that administration keeps their legislative branch informed. We are an equal branch of government. We have limited powers, and we are left out. Allegheny County.
This is Bobby Heenan, Chairman. I apologize. I don't mean to interrupt your opening. If we could keep it to the legislation that is in front of us and
Yes.
simplify it so we can get so we can move on with
in a minute.
Long day.
Yes, I'll be done in a minute, Chairman. Thank you very much. I think everyone appreciates you reining me in. So let me give a comparison. Allegheny County, with a population of 1.2 million people, has, as of this month or last month, 76,000 cases of COVID-19, 1,720 deaths. Philadelphia has 119,000 cases of COVID, 3,139 deaths. We have had more restrictions. We have been identified and given more vaccines. We get it directly. And there are issues that have not been answered, and I think it is important to pass this bill. Thank you very much.
Thank you, Councilmember Rowe. Chair recognizes Councilmember Brooks on her bill. Councilmember Brooks?
Yes. Can I wait until closer when we're getting ready to discuss the actual bill?
I think that's very kind of you. Thank you so much. So before we get started and go to the witnesses on bill number 200678, I want to thank all my council members, all the witnesses and panelists here, and the general public who have joined us on these two bills. I'm going to ask the clerk to please call the panel for our first witness this morning on bill number 200678. Sabrina, thank you.
Jim Engler, Chief of Staff of the Office of the Mayor, and Dr. John Rich, member of the Philadelphia Board of Health.
Good morning, Vice Chair Heenan, members of the Committee on Public Health and Human Services. My name is Jim Engler, Chief of Staff to Mayor Kenny. With me to provide answers to questions is Director Eva Gladstein, and also joining us later after he comes in from his event is Health Commissioner Dr. Thomas Farley. Thank you for providing an opportunity to testify on Bill 200678, which amends Chapter 6200 of the Philadelphia Code to attempt to impose certain restrictions on emergency health control measures by requiring City Council approval of those measures after a certain time interval. The bill is currently before the committee would apply these changes to all current and future instances of public health control measures, but I understand amendments may be considered that attempt to limit these specific changes to measures imposed to limit the spread of COVID-19. While we appreciate the attempted clarity of the amendment, we must respectfully oppose the bill in its current or amended form. It was 1 year ago this month that the city first felt the effects of the COVID-19 pandemic. On March 10th, the first case of COVID-19 was diagnosed in Philadelphia. On March 12th, 2020, Dr. Farley issued the first emergency health order related to COVID-19, banning mass gatherings of over 1,000 people. This first health order was slated to last for 30 days. The next day, March 13th, 2020, Mayor Kenny signed Executive Order 3-20, declaring an emergency in the city related to the pandemic. On March 17th, 2020, Mayor Kenny and Dr. Farley issued their first joint order prohibiting the operation of businesses deemed non-essential to operate during the public health crisis. On March 19th, 2020, Governor Wolf expanded his previous non-essential business closures to include any business not deemed life-sustaining, and the city complied with this order. On March 22nd, 2020, Mayor Kenny and Dr. Farley issued a subsequent stay-at-home order, further clarifying what businesses and activities were safe to conduct during the ongoing public health emergency. Governor Wolf followed suit on March 23rd, 2020, implementing a stay-at-home order for the entire Commonwealth. The Board of Health for the City of Philadelphia adopted the city's March 22nd, 2020 order as a regulation, permitting the Commissioner and Mayor to make additional orders as necessary to limit the spread of COVID-19. These limitations were largely in place until May 29th, 2020, when the Mayor and Dr. Farley determined Philadelphia was in a position to move to a modified yellow phase, as determined by Governor Wolf. On July 3rd, 2020, the Mayor and Dr. Farley determined Philadelphia was in position to move to a modified green phase, as determined by Governor Wolf, and subsequent amendments were made to this order on September 15th and October 23rd to permit greater capacity at events. With case counts rising in November 2020, the Mayor and Dr. Farley issued a new order on November 16, which placed further restrictions on certain activities and gatherings to stop the spread. On December 10, 2020, Governor Wolf issued a subsequent substantially similar order limiting certain activities and gatherings across the Commonwealth. Mayor Kenny and Dr. Farley have made subsequent adjustments to their previous orders on December 30th and January 15th, 2021, and again just this week. This recitation, as long as it is, includes less than half of the policy changes that the mayor and the health commissioner made to protect the residents of Philadelphia from COVID-19. It is meant to illustrate that this process has been complex, complicated, and iterative. Although a number of our dedicated health department and Office of Emergency Management staff have trained for years for occurrences like this, none of us have ever lived it. We have learned, adjusted, and frequently made difficult and unpopular decisions. But those decisions were made entirely through the lens of public health. They were made in order to save lives. And while tragically we have lost over 3,100 residents to COVID-19, Philadelphians have been spared the overrun hospitals and drastic loss of life seen in other jurisdictions because of the incredible work of our healthcare professionals and the difficult and painful decisions we made during the most dangerous points of this pandemic. This is best illustrated by the orders issued this past November. On November 16, 2020, the day the city announced new significant restrictions, we reported 2,564 new cases of COVID-19. The restrictions went into place on November 20, 2020, and Philadelphia reached a peak of new cases on December 7, 2020, with 2,757 new cases of COVID-19. Since that point, in large part due to the restrictions put in place, our case counts have continued to drop. In comparison, our immediate neighbors in Pennsylvania did not implement new restrictions until December 10, 2020, under an order issued by Governor Wolf. When reviewing their case counts on a per capita basis, all saw a sustained increase at the same time as Philadelphia, but instead of dropping precipitously with our case counts in mid-December, their case counts remained high, finally beginning to drop 15 to 20 days after implementation of the governor's order. In all, from the time of our order on November 20th through the date we rescinded it on January 15, COVID case rates fell 38% in Philadelphia, but rose 10% in Pennsylvania as a whole. During that time, Philadelphia went from having the highest case count in the region to the lowest. If we had not taken the action we did to restrict certain activities, it is likely we would have seen higher case counts, hospitals under greater strain, and more COVID deaths. Bill 200678 would require affirmative approval of City Council for the continued imposition of any restrictions 60 days after they are first imposed. The amendment shared with the administration limits this required council affirmation only for COVID-19 related restrictions. All current orders related to COVID-19 restrictions are time limited and subject to constant review and revision by the health commissioner. This process just played out in the last week, with previous restrictions ending on February 28th and a new order put in place effective March 1st, containing less stringent restrictions. The ability to respond quickly to the changing nature of a pandemic has proven critical, whether it was 1 year ago when the city and Commonwealth were forced to implement new and more drastic restrictions every few days to stem the tide, up to today when we are closely monitoring daily case counts to determine when it is safe to reopen certain activities and gatherings. Adding the requirement for council action could add weeks to this process, forcing the health department to make assumptions on how data will look weeks in the future. But given the reality of the time needed for council legislation to proceed under the law, the administration would be required to propose extensions of its orders within weeks of their imposition, even while at the same time evaluating whether to lessen, or if absolutely necessary, increase those restrictions, which very well might require a new order and a restart of the process for seeking council extension. In an environment where circumstances can change in a matter of days, any delay or problems with the mechanics this process could have unintended and potentially deadly consequences. Bill 200678 also tracks similarly to an effort at the state level to restrict the governor's emergency declaration powers. In May, voters will decide whether to amend the Pennsylvania Constitution to limit the governor's ability to extend an emergency declaration beyond 21 days unless approved by the General Assembly. This significant curtailment of executive authority to act during an emergency situation could have disastrous results. The legislature has a vital role to play in the oversight of activities undertaken during an emergency. There should be frequent reporting to the legislature on why certain decisions have been made, and opportunities for legislators to ask questions in view of the public. This body is, of course, free to hold hearings on any aspect of the administration's management of its role in the pandemic, and has done so, most recently in connection with vaccine distribution. But ultimately, the public health experts of the executive branch must be given the flexibility to use their training and all available data to make decisions quickly to keep residents safe. The same applies to Bill 200678. Members of the administration are here, as we must be, to answer your questions and continue to commit to provide regular reporting to Council on where we stand with the pandemic. This administration will continue to follow that example and work with our partners in City Council to keep our residents safe. Thank you again for the opportunity to provide testimony today, and we are happy to take your questions.
Thank you. Before we call our next panelist, I'd like to recognize that we are joined by Council members Maria Cuanona Sanchez and Council Member Dom. Clerk, would you please call our next panelist?
Dr. John Rich, member of the Philadelphia Board of Health.
Good morning, Chairman Heenan, and members of the Public Health and Human Services Committee. I'm John Rich, an internal medicine physician and professor of health management and policy at the Drexel University Dornsife School of Public Health, and a member of the Philadelphia Board of Health. I'm here today humbly representing myself rather than speaking either for Drexel University or for the full Board of Health, to give testimony on Bill 200678, which proposes to place limits on the Board of Health's ability to implement measures to protect public health in the event of communicable disease epidemics. I'm here to speak to the importance of the role of the Board of Health in overseeing Philadelphia's response to epidemics like the one that we currently face. As you know, the Board of Health serves as the regulatory body of the Philadelphia Department of Public Health, providing expert judgment on matters related to public health issues and regulation. The current board is comprised of the full complement of medical and dental public health professionals defined in Section 3-901 of the City Charter. The Board of Health is made up of experts who volunteer to lend our medical and public health experience and expertise to address critical public health issues. The board's expertise is both broad and deep. The current board consists of the physician leader of a network of federally qualified health centers, the dean of the Drexel School of Public Health, an internationally known physician and epidemiologist with particular expertise in urban health and health inequities, a renowned pediatrician whose work to address asthma and poverty in urban communities has been recognized and replicated throughout the country, an infectious disease physician and former dean of the Drexel School of Public Health who played key leadership roles in Philadelphia public health to address measles outbreaks and the HIV/AIDS epidemic, a public health leader and Temple public health professor whose work addresses policy solutions to tobacco use, the dean of the Morris H. Kornberg School of Dentistry at Temple, an internationally known expert on dental health disparities who holds degrees in dentistry, public health, and business. As for me, I'm a physician who has focused my career on urban health, and I served as medical director for the Department of Health in Boston for 7 years, throughout the years surrounding the 9/11 attacks and the West Nile virus outbreak. The Board of Health provides oversight to the Health Commissioner by adopting, by regulation, the orders issued by the Health Commissioner. All throughout the pandemic, Commissioner Farley has consulted with and updated the board. Every order has come to the board for approval by regulation. These approvals are what solidify the orders in the law in accordance with the board's oversight role, a role that the board has been carrying out. All of these measures have been carried out in the name of public health, and the board has provided oversight to show that these measures are what makes sense. I serve in this capacity as a public servant who makes full disclosure of my financial matters and potential conflicts of interest. As a board member, I elevate the science which is known, even when the science is only yet emerging or evolving very quickly, as it continues to do. The breadth of the board's experience allows us to engage with literature and experts across a range of disciplines in cities across the globe to understand how diseases are emerging. Certainly in the case of the coronavirus pandemic, I have, as a board member, carefully considered data about the epidemic as it is evolving and as knowledge is emerging to make the highest integrity decisions possible to save lives, prevent spread, and address the critical issues of health equity, focusing on protecting those who are most vulnerable and most susceptible for infection and death by this unforgiving virus. In doing this, I follow a long history of my forebears who have served on local boards of health. I count among my ancestors in this regard Paul Revere, who in the role of the first president of the Boston Board of Health, led the fight against the yellow fever epidemic in 1799. Although the cause of the yellow fever was unknown, at that time, Revere enlisted the expertise of physicians to create a strategy for control that included cleaning up nuisances such as standing putrid water, which only later was identified as a breeding ground for the mosquitoes which carry yellow fever, but also quarantining ships known to be carrying sailors infected with yellow fever, even though these ships carried needed supplies for the population, and enlisting the help of citizens and laborers to mount a broad and ultimately successful public health response. I truly believe that the role and functions of the Board of Health, both here and across the country, in cities across the country, are critical to controlling the spread of current and future epidemics. The board is also critical to advancing a swift response to a rapidly changing and dynamic pandemic where delays in action, even of a few days, can make a difference in disease and death. As important, the board takes seriously our charge to advance health equity by protecting those who are most vulnerable, those whose voices are less heard, and those who have less choice about how they can change their employment, housing, or school to protect themselves and their families from disease. I urge the committee not to place limits on the board's science-based mandate to protect Philadelphia's public health in times of unprecedented infectious disease risks. Thank you for the opportunity to offer testimony and for the tireless work of this committee in protecting public health. I'm available to answer any questions you might have.
Thank you for your testimony. And before I open it up for questions of the committee, I just want to remind members and all those that we have a hard stop with Channel 64 at 12:30. That's a hard stop. So in order to conduct our business, I'd like to be very succinct in our questioning. And for those panelists, if you can summarize your testimony, we would be grateful because we have your written testimony on the record. With that, I'd like to recognize Councilmember Rowe.
Thank you very much, Chairman. My first question will be for Dr. Rich. And first, Dr. Rich, thank you for your service, serving our city in this public capacity. Are you aware of how Philly Fighting COVID, the founder, 22-year-old Andre DeRochen, was appointed to the Health Department's Committee on COVID-19?
So to be clear, the Board of Health does not have purview in those matters. The Board of Health's role is regulatory as detailed, and the day-to-day workings of those department issues did not come before the board.
Okay, thank you very much. You mentioned not placing limits on the ability of the Board of Health to act to protect the public health. This bill does not limit the health commissioner, the Department of Health, or the Board of Health in its day-to-day functions. It does require that after a period of time, in this case, 90 days after this bill passes, which is in addition to the year that this has been going on, that the Department of Health, the administration, and health commissioner come before council to explain what they have done, to give the council information on how effective it has been and what they are doing in total, including the distribution of vaccines in all our communities, in order to seek a continuation of emergency powers. That's what is done in other cities, such as Pittsburgh. Do you in any way feel that the reporting that is done before City Council in Pittsburgh is a limitation on the health department acting in the best interest of its residents?
I do believe that it is relevant for reporting, for the council to request whatever information is necessary to understand how the decisions are made and what the basis for those going forward. The concern would be if the decisions that are science-based are subject to being halted at critical times. I think that the decisions that are made are often necessary to stop the spread of the virus and to have as many of these, though inconvenient, many of the measures that have been taken require sufficient time as we look closely at the data to make sure that the virus is not spreading. And so we're looking closely at those data. So I would say information, I completely agree that the ability to hear information is under the power of the council and is appropriate.
Thank you very much, Doctor. I'm just going to follow up with the Chief of Staff, James Engler. Following up on that, I did read and I did hear your testimony. However, again, we are not interfering, although yes, we will have an ability not to extend, but basically, from what I understand, the Department of Health holds public information, press conferences, and informs the Board of Health what's going on. And so it doesn't seem to be that difficult to come before council and to explain what's happening. The reason I introduced this bill, quite frankly, is because the briefings are inadequate to me. And if there's a council member who can go out and publicly explain to everybody what's going on, what's been going on, what's going to happen, they must have information that I'm not privy to. If that is through some type of informal process, it's not public and I'm not aware of it. Therefore, what I have done is introduce a bill to say there's not an unlimited amount of power that the health department can have to not inform the public and not to respond. If you can tell me, and if you can explain to me how Philly Fighting COVID, was selected for what appears to be, based on testimony of Dr. Farley, a no bid, no actual contract deal to distribute vaccines in African American communities, is what I understand. I don't know how that was done. Can you explain that to us?
Thank you, Councilman. So this is the third time that I've appeared before the committee in the last month. I know that you've had access to high-ranking members of the administration, whether it's myself or Dr. Farley, Tamar Alexander, the managing director, Eva Gladstein, the deputy managing director. So we have frequently appeared before this committee as well as in other forums to provide answers to your questions, to provide updates on the briefings. I will say we've talked about the issue related to Philly Fighting COVID, the decision to provide them with vaccine, the process they went through to be approved by the CDC for the provision of that vaccine. That is subject to an ongoing investigation of the Inspector General. We expect to have that completed, I'm hopeful, over the next week, and be able to share those findings publicly so that members of the public, as well as members of this committee, City Council as a whole, can have that information. But the issues around Philly Fighting COVID are in no way addressed by the piece of legislation that we are discussing today. The issues addressed in the legislation are related to restrictions on gatherings and other public or private activity that the health department, in addition to the administration and then presented before the Board of Health, can limit. Nothing related to Philly Fighting COVID in any way is called into question or in any way related to the subject matter of this bill.
Well, I'll disagree with that because fundamentally, the emergency powers is to restrict people even from leaving their homes. There was a stay-at-home order for a period of time where you couldn't go water your lawn or go into your backyard after a certain period of time. You stay at home. And the orders that restrict people to gather, not go to family gatherings, funerals, weddings, all that stuff, affects different communities. And so the answer to getting to ending the restrictions, among other things, but most importantly, is vaccinating people. And so to get an answer on what is going on with these vaccines, which to me, listen, I have participated in the briefings and I don't have an answer. I cannot explain to people what is happening. I can't tell them where to go to get a vaccine. I know FEMA is here. I don't actually have satisfactory answers. And I think the issue is that this body is being briefed as a courtesy and not because we have any power to ensure that our questions are being answered. And the distribution of the vaccines, to me, is critical at this point in time after all the suffering that has occurred during COVID-19. And with that, you can answer or not, but I'm going to end my questioning. Thank you.
Thank you. Mr. Engler, you don't have to answer that at the moment because I'd like to kind of refocus and stay on the legislation that is in front of us now for expediency. Council member, I thank you so much for always being a champion and looking out for concerns that you have for our city and the general public. Does any other member have any questions for the panelists? I see that Council member Derek Green.
Thank you, Mr. Chair. Thank you, Mr. Engler and Dr. Rich, for you being here and testifying. I just wanted to follow up on some of the statements made by Councilmember O in reference to what's happening in the city of Pittsburgh with a population of about 300,000, which is part of Allegheny County, which has a population of about $1.1 million. 1.1 million people, excuse me, not $1 million. Compared to the population of the city of Philadelphia, about 1.5 million. He stated information in reference to the mayor of Pittsburgh following certain procedures, and I'm curious on your perspective in reference to Councilmember O's statement about the mayor of Pittsburgh following certain procedures versus here in Philadelphia.
So I'm unfamiliar with the process that the mayor of Pittsburgh undergoes to implement their emergency powers. My assumption is that their emergency powers are different insofar as the city of Pittsburgh doesn't have a health department. The Allegheny County Health Department provides health department services for the city of Pittsburgh as well as the entire county. So the grant of authority that the mayor of Pittsburgh has is just vastly different than the mayor of Philadelphia. The requirements of span of control is vastly different than the mayor of the city of Philadelphia. I'm not certain to which emergency powers the councilman is referring. Happy to look at it and see if there's adjustments need to be made. But the legal grants of authority from both the Commonwealth to the county health department, as well as from the Commonwealth to the city governments, are just different in this respect. The councilman also mentioned in his opening comments the impact of the virus in Pittsburgh and Allegheny County compared to Philadelphia. I will note that the southeast part of Pennsylvania has been much more highly impacted than any other region of the Commonwealth. Both Philadelphia and the surrounding counties were where the first instances of the virus were found and have seen the highest number of cases, hospitalizations, and death compared to anywhere else in the Commonwealth. So I'm not sure that they are directly analogous, as well as the comparison between Philadelphia, Pittsburgh, and Allegheny County.
And Philadelphia being the only city of first class in the Commonwealth of Pennsylvania, which is both a city and a county, is your understanding that the executive actions that the mayor took are keeping with the whom will power of the city of Philadelphia that's granted from the Commonwealth of Pennsylvania?
Yes, that's my understanding. Every order that both the mayor and Dr. Farley sign is reviewed by the law department as to form and as to substance. It's approved by the law department before being signed off, is then presented to the Board of Health by Dr. Farley, as well as attorneys on behalf of the law department for entry into regulations. So all of our process is legal under the grants of authority coming from the Commonwealth.
Thank you, Mr. Chair.
Chair recognizes Council Member O on the point of order.
Thank you very much, Chairman. Just briefly, the powers are the same. That is that the mayor of Pittsburgh has emergency powers to restrict gatherings and city services and other things, just like the mayor of Philadelphia. Thank you.
Thank you, Council Member. Chair recognizes Council Member Kim.
Thank you very much, Mr. Chairman. I'm not sure the previous point of order made seems to affirm that mayors have these emergency powers, but I will maintain my questions on this. I just wanted another bit of clarity from your vantage point, Mr. Engler. This bill talks about overriding the potential to override an emergency public health order by a majority vote of council. And then for clarity, the Philly Fighting COVID information or services, while justifiably making people upset, is not related to your emergency powers. Is that correct?
Yes, that's correct.
Okay, thank you. And can you estimate how many times you or the health commissioner have come before council to talk about public health emergencies? This would include briefings as well as hearings. I know it may be a lot. We didn't ask you ahead of time, but could you guesstimate?
I cannot. I know that I have just since December, I presented testimony before Councilman Dom's Fiscal Stability Committee, and now 3 times before the Public Health and Human Services Committee, in addition to doing now weekly briefings for all elected officials, weekly briefings for City Council leadership, as well as other presentations. I don't know. I know Dr. Farley has had other engagements before this committee, before City Council, before members of the Philadelphia delegation in both the Senate and the House, as well as the congressional delegation. I'm not entirely certain of how many or how frequent those have been. I know they have been, understandably.
Would it be fair to say that there have been dozens of times that you've appeared?
I think yes. I think that's absolutely fair.
And then under this bill, which requires you to come before City Council every 90 days, that means you would be required to appear 3 times. Is that right? Since the public health emergency order went into effect. Because it's every 90 days, so you would estimate.
I was trying to do the math in my head. I apologize, Councilwoman. Yes, I think that would be the interpretation.
Okay. And then Dr. Rich, first of all, I want to thank you for your service and for your expertise in this area. Could you speak a little bit, because I think one of the things that we are dealing with in communities, and this is a very real issue for many different communities across the city, is that we are not health experts. We are, I don't believe, and maybe I should be corrected, I don't believe anyone on council has a medical license or a medical degree. Though we take the job and the value of your work very seriously. Could you speak a little bit to your professional role in terms of working closely around educating the public around a public health issue? Because we are in a situation where while we have dealt with the flu, we have dealt with other kinds of viral outbreaks, measles, mumps, polio, for God's sakes, is on the rise in other parts of the world because of a lot of, lack of trust and lack of understanding. But at the same time, from a professional vantage point, can you speak a little bit to the importance of, your role or some of the work that you've done to kind of override misinformation or lack of information or expanding the public trust around public health orders and issues?
Thank you for that question. I think that this has been, the point that you make is critically important. And it is especially challenging to provide information in a situation that is moving very quickly and very dynamic. I think that the most important role that we can play from the perspective of the Board of Health is to promulgate regulations that clearly look at the data, look at the science, and then put in place the least onerous restrictions necessary to control the spread of the virus, but particularly given that the knowledge is emerging. And so I think what we try and do is to be as clear about what we know and transparent about what we don't know, so that we can make sure that the trust of the community is sustained. I think that our ability to, again, say what we don't know as the situation is evolving is important. And then I think we have to pay attention to making sure that all of the systems work together. Referenced Paul Revere in his initial role in that epidemic, but the Board of Health and Health Department will do one portion of this that is very much based in science, but then we have to mobilize the entire community to meet the needs of those who are going to be disproportionately affected by that. And so to the extent that our role also identifies for people and communities the resources that they need to be able to be well and safe and maintain their health in other ways during this pandemic, while also, again, articulating and translating the science as accurately as we can, that is a role that we can play, partly the Board of Health, but the Health Department overall.
Again, I want to thank you for your work. We are dealing with a lot of this, whether it's around the School District of Philadelphia, outreach into communities that have long been neglected and marginalized within our city. I understand how important it is. And I do think when it comes to public health issues, you know, you are dealing with a small percentage that is about science and medicine and a larger percentage that is about educating the public and getting the public to change and adopt practices that transform not only their own lives, but the directional future of our community as, you know, a holistic body. So I just want to thank you again for your work. And would it be fair to say that do you feel like we still struggle with understanding about public health issues more broadly?
I think that public health has been, to some extent, invisible. It's often said that when public health is working well, it is particularly invisible, and therefore it may not be as prominent before us. I think in times of epidemic and others, the role of public health becomes more apparent, and therefore I do think we need a broader dialogue about how we rebuild the public health infrastructure so that it is more visible to people in communities and the services that are available are more transparent as well.
All right. Thank you very much, Mr. Rich. Thank you. Dr. Rich, thank you.
Thank you, Council Member Kim. Chair recognizes Council Member Green.
Thank you, Mr. Chair. I just have one final question for Mr. Engler. I understand that a number of people are concerned and fearful regarding this pandemic. A number of council members, myself included, raised serious questions in reference to Philly fighting COVID and that process. We actually had a number of press conferences and other issues and trying to get dollars to Dr. Ayla Stanford, which initially the administration was, I would say, resistant to doing so, but is now partnered with Dr. Stanford. We also had press conferences and discussed other options for vaccination sites in the city of Philadelphia as a way of augmenting the work and distribution and rollout. And that was based on my experience in conversations with fellow elected officials around the country. And so, you know, I've had some very strong concerns about the process of how we vaccinate people in the city of Philadelphia, how we've done some of the issues in the city of Philadelphia. And also, I'll just state for the record, the statement that was made that I, by supporting another location like Lincoln Financial Field, was somehow trying to expedite vaccines to people that live outside the city of Philadelphia to the detriment of Black and brown taxpayers, I thought was, at the very least, I'll remove public statement about that comment. I'll just say that it was something that should not have occurred. Basically, me being a person of color who was born Black and will die Black. But at the same point, how will this legislation impact the city from doing what it needs to do in reference to providing public safety when we have issues of new variants of the COVID-19 strains that are occurring and other type of changes that need to occur very quickly in order to protect citizens in the city of Philadelphia?
Thank you, Councilman. So as I mentioned in my testimony, I think the ability for us to react quickly and make adjustments to our restrictions in an expeditious fashion has been very helpful for us. In early March, when the pandemic first hit, we were able to make some significant changes over a very short period of time that, yes, imposed some very serious restrictions and had those restrictions in place for weeks on end, but also really helped us stem the tide of the virus and have us not see the peaks that we're seeing in other jurisdictions in very close proximity, whether it's New York City or even in New Jersey. So I think those restrictions and the ability to impose them quickly and to do so without having to go through kind of a formal legislative process that could take a week for introduction, a week for a hearing, and then 2 weeks for final passage could add some time to that process that would hurt our ability to respond quickly to, say, a new variant that starts spreading very quickly in certain sections of the city. So I think retaining the ability to respond adequately and quickly to the virus through new or adapted restrictions is really critical, and this bill would impact that.
Thank you, Mr. Chair.
Thank you, Council Member. Are there any other questions to our two panelists from members of the committee? I want to thank our Chief of Staff to the Mayor and our member, Dr. John Rich, for Board of Health. Thank you for your testimony and answering the questions that this Council committee has. Thank you for joining us. Madam Clerk, would you please read our second panelist, please? And again, I want to remind everybody, we need to be very clear and concise in our questioning for the sake of time. We have a hard stop at 12:30, and I'm very fearful that the two bills that are in front of this committee today might not be heard in its entirety for this body to take action. So please keep that in mind as we're going through our process here in our hearing. Madam Clerk?
The participants for panel 2 are J. Nathan Basil, HIV rights advocate, Emmanuel Bussy, Director of Operations for Professionals for Progress, Imam Whedon Muhammad, President of the Muslim League of Voters for Delaware County, Asteria Vivas, Community Leader for the Home Quarter and Friends, Reverend Michael Robinson, Senior Pastor of the Greater Enon Missionary Baptist Church, and Roman Zukov, President of the Northeast Philadelphia Connected.
Our first witness to testify. Sabrina, could you call our first witness?
J. Nathan Basil.
Thank you.
Yes, good morning. My name is J. Nathan Basil. I am a lifelong Philadelphia and Philadelphia area resident, and I am a person living with AIDS. It's a little different than saying HIV, meaning that I have experienced complications resulting from HIV infection. As a result, I have been through many medical procedures, as well as some various experimental tests to try to find a cure for HIV/AIDS. People with HIV/AIDS face discrimination every day, even in 2021. We face it in housing discrimination, we face it in financial discrimination and job discrimination, not to mention social discrimination. Recently, it became very public that Philadelphia was the only county at the time in Pennsylvania that did not include people with HIV on the Section 1B of the vaccination schedule. This just hit myself and many other residents living with HIV/AIDS as discriminatory and discrimination coming from the city of Philadelphia. We all had to ask ourselves, why would Dr. Farley or the health department or the vaccine advisory board remove people with HIV/AIDS from this schedule, which the state had already approved? One might ask, well, maybe it's a CDC issue? Well, if we take a look at the CDC's website, they very clearly state, if I can get back over here, I apologize. There we go. That people not on effective HIV treatment. So how does this play into this conversation? In Philadelphia, 51.6% of people living with HIV are virally suppressed. That means that they are in a state medically where they are undetectable and therefore in a safer and stronger immune system position. With the CDC saying people not on this in this state should be considered and should be given the vaccine, that leaves almost 50% of the HIV population of Philadelphia vulnerable. Yet we were removed. It's a question that we keep asking ourselves, why were we removed? When we look at especially in Philadelphia, it's important to remember that 66% of HIV/AIDS patients in Philadelphia are African American. 20% are Latino, and many of those are English as a second language. When we are looking to ensure that all populations of Philadelphia are vaccinated equally and effectively, it is important that we include people with HIV in Section 1B. And we still don't know why Philadelphia was the only county to not include us. How are we supposed to trust a health department that removes us when the state included us? And the CDC even recommends including us. We know that the city is aware of the HIV population. We know that they're very involved in finding treatment and taking care of our HIV population. They do very well on many levels. But for some reason, during the COVID-19 pandemic, we feel as though we're pushed aside. So we look to city council to be our voice. How are people supposed to trust a health department that removes them if we feel that our voice is silenced? This bill will help ensure that city council, our voice in government, is able to explore and seek answers to these questions. We should all be asking, why were people with HIV removed from this list in defiance of the state recommendation? It makes no sense. We have between 18 and 19,000 residents living in Philadelphia County with HIV/AIDS. So why? That's what this bill will do. It will give you the ability to be our voice and to be our safeguard in the population. Thank you.
Mr. Chair, I have a point of information.
Councilmember Green?
Yes. Mr. Basil, thank you for your testimony. Myself, as well as Councilmember Mark Squilla, have been asking Dr. Farley about this very same issue. In fact, there was a recent article in the Philadelphia Gay News about this issue. I've also raised a concern regarding autism. My understanding is that the health department has since changed their position based on a recent article I saw in the Philadelphia Gay News to now include HIV and AIDS in this category.
That is correct. And right here is the city's page on that, which they posted on February 23rd. But just like Philly fighting COVID, it doesn't change the fact that it was allowed to happen. And I have to sit here and I have to look at these numbers. 66% of people with HIV/AIDS in Philadelphia are African American. 20% are Latino. And we're also still dealing with the fallout on Philly fighting COVID and the Black Doctors Consortium being pushed aside for quite a while. I have to keep asking this question: what's the problem going on here? And this is where we need City Council to have the ability to ask these questions.
Thank you. I totally agree. That was part of my reasoning, asking those questions to Dr. Farley during our intergovernmental calls. And I'm still asking a question regarding autism, which is an issue that I've raised as well, why it's not included like other learning and physical differences like Down syndrome. Thank you, Mr. Chair.
Thank you, Council Member. Thank you for your testimony. Just of note, the decision I believe that you're talking about is from the Vaccine Advisory Commission. That's where I believe that decision came from. But I want to ask, please, to everyone else on the panels moving forward. Sabrina, would you please, or better yet, Modesto, our technical support, would you please start a 2-minute time for public comment? And I'm asking everybody to please summarize your written testimony. And your written testimony, I want to remind you, has been submitted for the record. Otherwise, the 2 bills in front of us today will be stuck in committee, and I'm sure that's not what people would like. So for the interest of time and everybody's voice being heard, we're going to limit to 2 minutes. Please summarize your testimony. Clerk, would you please read our next, introduce our next witness, please? Thank you.
Emmanuel Bussey.
Thank you very much. Can you hear me?
Yes, sir. Loud and clear. You may state your name and proceed with your testimony.
Yes, my name is Emmanuel Bussey. I'm with Professional Progress. I'm also a different kind of Democrat. I thank you, Chairman Bass, for calling this hearing. Thank you, Councilman Heenan, for moderating and facilitating this hearing. It is very difficult for me to remain calm while I listen to the testimony that was given before us. Let me start my timer so I can stay within 2 minutes. Because we elected council people, I'm gonna just summarize it. We elected council people like Isaiah Thomas from the neighborhood, from well-educated, in touch on the ground. Derek Green from the neighborhood, in touch on the ground, an attorney. Councilman O, living out in Southwest Philadelphia all his life, on the ground, in touch. Kendra Brooks, one of us, straight activist. Like, we elected you to cut through this bullshit crap, right? To cut through it. Because you all know that what we just heard was a bunch of crap. I sit on meetings every Sunday with 30 to 50 activists and community leaders like myself. Not public neighbors and activists, who's also a committee person like myself. And we are outraged at what we hear. The fact that council may potentially say, I don't want to oversee what the heck is going on in the health department, when you know all the challenges we have with information. It's one thing. See, you guys ask questions, which is a bunch of crap, and I can't wait till Sunday to go back and tell the bull crap I just heard. You ask leading questions to the mayor's administration as if you're the mayor's cheerleaders. How many times have you came before us? That's bull crap. Where there's no measurement, there can be no accountability. You need measurement. You need them to come before you because they have to, because there's a consequence, because you will lose your emergency powers if you don't answer questions. To sit up here and even on this forum right here say, I don't know, we don't know the answer to that. We can't understate the fact that this body had a 22-year-old on the board that had no health experience, who had an all-white executive team get a deal from the city, which in his own words, quote, we're a group of college, let me get this quote, self-described group of college kids. This guy is a self-described group of college. We can't underestimate that. And you can say that won't have any effect on this legislation, but I guarantee you, if the health department had to come before Derek Green and Kendra Brooks, that they would have asked those kind of questions. Well, who's going to manage the vaccination process? Where's the experience? They would have asked those questions. You may say that this will have no bearing on Philly fighting COVID, but I guarantee you, had that body was mandated to come before Derek and before Kendra, that they would have asked those questions and got those daggone answers if their emergency powers would have hindered on that. Right now, there's no accountability. So there's no measurement. So they can do whatever the heck they want. They can tell you, I'm not answering you. And you guys know, stop bullshit crapping us. You guys know you get most of your information from the press about what's going on with this COVID mess that's going on in our city. Nothing else could be like you allocating your duty as council people so you don't have to get blamed later is a bunch of bull crap. again, I'm going to try to stay calm, but we elected you, Derek Green, Isaiah Thomas, Kendra Brooks, because we have confidence in you. We trust you. We need them to come before you and ask those questions. And if you like what you hear, say, go ahead, keep on. Go on and keep on as planned. If you like what you hear. If you don't like what you hear, shut that crap down. That's why we elected you. I'm done.
Thank you for your testimony. Chair recognizes Councilmember Dom.
Thank you, Mr. Chair. I do have some questions. I don't know if the Commissioner Farley is here or Mr. Engler. I just wanted 3 quick questions. I won't be long. The latest news reports are showing that our vaccine registrations are at about 200,000. And I'd like to know if we have information on that list. For example, what % of these registrations are people of color? And can we help identify the vulnerable communities we're seeking to target in our vaccination plan? Is that Mr. Engler or anyone from the health department?
I think Dr. Farley hopped off after our part of the testimony. Councilman, we can check that and get back to you as far as pulling numbers from the list of the vaccine interest form. I don't know the numbers while I'm sitting here. We can discuss it and see if we can have it for the members of the committee.
Is there any ballpark number, would you say, or we don't have a ballpark?
I don't know the racial, gender, or geographic breakdown of the folks that have signed up for the vaccine interest form.
Well, let me ask you this question. If the number's lower than 44%, which I'm pretty sure it probably is, okay, how can racial equity be achieved through the current FEMA site?
So we continue our vaccine outreach. We have a program through our Philly Counts folks where we're going door to door. We're standing up our vaccine communications plan, which will be a paid media campaign to get folks to sign up for the vaccine and to tell people that it is safe to get the vaccine. So all of that work continues. For the FEMA site, we are pulling from our vaccine interest form, and we are pulling from priority zip codes that we know are under-vaccinated. We have a document that'll be going to council end of the day today, early tomorrow, which will outline those priority zip codes. It's also on our website now with our vaccine data form that shows what zip codes we have under-vaccinated so far and where we'll be pulling folks from for the purposes of the mass vaccination site, in the same way as we're doing for other community vaccination sites, the ones that the health department is running, ones that our partners are running, like Albert Einstein Hospital Network. So all of that is coming from those priority zip codes.
So the other question, Jim, is that do you guys have available for us to see a transit plan, a parking plan, a safety plan for the FEMA site?
Yeah, so we will have, after today's press conference with the DHS secretary, we are putting out a press release which will announce all of the transportation options, the parking options. That will also be included as an appendix to the plan submitted, again, to council leadership today, and I believe to all of council either by the end of the day today or tomorrow.
Does the parking plan give the ability to people to park there for free?
Off the top of my head, I don't know the specifics. We have worked with a number of the parking operators in the general vicinity, both the PPA as well as the privately owned lots, and we're working with SEPTA, obviously, for their transportation options. So all that'll be included in the document that is submitted to council.
Some of the concerns revolve around the following. Many of us stood up to use the link as a mass vaccination site, as 30 other large cities in the country are using. Having said that, we asked 2.5 weeks ago about this, or 3 weeks ago, and we were told we don't have enough vaccines, we need more vaccines, and we said, you need a plan so when the vaccines come into play, you will be ready. And you need a plan that can probably supply 75 to 100,000 vaccinations a week. Gillette Stadium in Massachusetts has a plan for 1 million vaccinations a month. What we're looking for is an ability for the city to muster a plan that can handle 75 to 100,000 vaccines a week over the next 4 months. We need to see that. That is crucial. That's number one in saving lives and getting our economy back on track.
Sure. And Gillette Stadium, the Gillette Stadium to the best of my knowledge, is run by a for-profit provider on behalf of the Commonwealth of Massachusetts, not on behalf of the city of Boston, because it's not in the city of Boston. But the plan will be submitted to council leadership today and to all of council at Councilwoman Sanchez's request before the passage of the transfer ordinance on Thursday.
Does that plan take into account getting to 75 to 100,000 vaccines a week?
So the plan takes into account our plans to do vaccination, I believe, through the month of May. So the plan encompasses what we expect to happen through the month of May.
And then, I don't know if you can answer this, Jim, or not. It might be the health department question, but how many Pfizer doses is the city currently sitting on?
So I don't know what you mean by the city is sitting on. We distribute vaccine doses to providers each week. A report on the number of vaccine doses that are provided each week was provided to all of council last Friday. So you have that to know who has been provided what doses, whether it's Pfizer or Moderna. We'll be adding, obviously, Johnson & Johnson this week once we receive our doses. So you can see who has received what doses, as well as the number of doses they've administered by provider. So all of that information was provided to council on Friday and will be provided on a weekly basis.
I think the overall message here, and I'm echoing my colleagues, is that I have concerns regarding council approving your plans. We don't seem to get them. And this body, I'd say we have not been given ample amount of information or an opportunity to provide oversight with the same access to information and data that the administration has. We've called for a plan. I've specifically called for a plan on how we can manage the influx of 100,000 vaccines a week. And I'm hopeful we're going to see that plan, but as of right now, we haven't seen it yet. So I'm hopeful that plan you're submitting to Councilmember Keona Sanchez today is going to include these questions that I'm asking.
So the plan that will be submitted today will be in response to the questions that Councilwoman Sanchez raised last week at the Appropriations Committee, as well as other questions we've received from City Council leadership. It's directly responsive to their requests.
Okay. All right, I'll come back on the questions. Thank you very much. Thank you, Mr. Chair.
Thank you, council member. Clerk, would you please read our next person to testify?
Councilmember, Mr. Chair, may I be recognized before you move on?
Absolutely. Councilmember Thomas?
Yeah, thank you, Mr. Chair. I know we're pressed for time, and I appreciate the opportunity to speak briefly. I just want to address some of the comments that's been made. First of all, I commend Councilmember O, because I definitely understand Councilmember O's frustration. It's something that we've been communicating for some time as it relates to trying to work with the health department and coordinating and some of the, what we all feel like lack of transparency, as well as unforced errors. Even yesterday, discussing some of the incidents that took place. I clearly understand Councilmember O's frustration, but I do think it's important that we recognize in the midst of this conversation that we're in the midst of an emergency. We're in the midst of a pandemic. This is something like we've never seen before in our life. There are other models and examples across the country. And I personally don't view this as us passing the buck. I think that this is us recognizing that I honestly would love to have a little more autonomy and mandate the health department to come before us more. But I also recognize that, number one, it sets a precedent that I'm very concerned with. And number two, in the midst of emergency, what we clearly seen was that we need to rely on folks who are experts in a particular area to make decisive and quick decisions that doesn't put us in a position where we might not be able to convene. I don't know if anyone remembers, but when we first ran into the coronavirus crisis and when everything first happened, council didn't even have sessions. We had to wait for legal opinions to put us in a position where we could even decide what we were able to do and weren't able to do as it relates to meeting. We went weeks without even being able to legally have a conversation with more than 9 council members at a time. And during those weeks where we legally were not allowed to have more than a quorum, there were executive decisions that were made that in hindsight were honestly the right decisions, because those decisions ended up saving who knows how many lives. So while I understand everyone's frustration, and I hope the administration is listening, because for Councilmember O to have to take the steps that he's taking today, which I completely understand, and I get his frustrations, for him to have to take the steps that he's taking today to offer this recommendation as a possible solution shows the outrage and the frustration of not just Councilmember O, not just this legislative body, but the entire city of Philadelphia. But at the same time, again, I'm just not quite sure that moving in that direction is the best way when we look at the importance of the executive branch and how quickly the executive branch had to respond when the emergency first took place, as well as, again, council's inability to essentially convene based on the Sunshine Act and other state laws. So I just wanted to offer a little bit of my opinion based on the testimony that I've heard today. And again, I appreciated everybody's passion. And thank you, Mr. Chair. I know you have to move on to the next panel, but I wanted to add my comments to the record. And again, commend Councilmember O, because I understand his frustrations.
Thank you, Council Member. Clerk, our next witness, please, to testify.
Imam Sued Wedin Muhammad, President of the Muslim League of Voters for Delaware County.
Thank you. May state your name and proceed with your testimony for the record.
Muhammad, resident Imam of Masjid Muhammad of Philadelphia, also the General President of the Muslim League of Voters of the Delaware Valley. So good afternoon. Good morning to all of the council and everyone present. So yeah, what I like to say is that one of the things is that COVID, this here COVID is over. I think is over the average common person's head, and we've been kept out of the loop about the whole situation. But the other thing is that this city is in great need of leadership. It's in great need of leadership. And one of the things is that this city council group is a very unique group of people. You're talking about 17 people out of 1.5 million. And these people were elected to represent us. Okay. And this whole thing that's going down, we look at the whole thing. I'm a pastor at the mosque at the church. And one of the first things that happened was the prayer in church was considered non-essential, but wine and spirit stores are open. And I'm looking at all these things, right? Because Councilman he took it and he mentioned about extraordinary circumstances. Extraordinary circumstances in this city, number one, is the homicide rate. Okay, the highest homicide rate in 13 years. We're talking about over-assessed properties in poor neighborhoods. We're talking about illegal sheriff sales. We're talking about school closures, right? Prior to COVID, where they talk about asbestos and all, those schools were closed down, turned into condos and apartments. There was no COVID yet, right? You're still talking about the poorest, biggest city in the country. We're talking about all of these things. We're talking about half the people in the city living below the poverty level. We're talking about another third of the people in the city living in deep poverty. That means they live off of $5,000 a year or less. And one of the things that we begin to look at, right, when you're talking about all this stuff about this here, Philly fighting COVID, and how this young guy took it and got this big contract to run the shots and all, Philly fighting COVID, right? Let's look at, you talking about the health department and everything else. Let's look at the other agencies in the city. Let's first look at the law department that's going against judges' orders, holding sheriff sales and everything else against judges' orders. Let's look at the Office of Property Assessment, right? You're talking about the young guy, he didn't have no doctorate degree from Philly fighting COVID. But let's look at this here Office of Property Assessment that don't even have a license or certified appraiser that's running around doing all these appraisals and putting this high appraisals on black people in the black community, right? So we got to address more than this. The COVID thing, I understand it and everything else. This city is in great need of leadership. And we elected those people down at city council. At city council, you don't have to be down there begging for your power. You have to take it. That's what you have to do. You don't have to be sitting there begging for your power. We elected you. So you have to take your power back. You have to represent the people. We sitting in this city with no representation whatsoever. No representation. Our schools are closed. Our children have been out of school for a whole year. And if you know anything about the poor black community, if you keep those children out of school for a whole year, I guarantee you most of those children through grades 9 through 12 won't go back to school. We got to really address this stuff. And so really, I'm appalled, really, to see city council down there. Don't be sitting down there begging for no leadership and begging for your power. We gave you the power. And we expect you to go ahead and use it because this city is in dire need. Fourth biggest city in the country. 45% of people living below the poverty level. 27% of people living in deep poverty. Highest murder rate in 13 years. And all we hear is no suspects, no motive. There's no leadership in this city. So I don't want to be a part of this city council sitting down there. I think city council just need to take their leadership.
Thank you much. Clerk, our next witness, please.
Asteria Vivas, community leader of Home Quarter and Friends.
Thank you. You may state your name for the record and proceed with your testimony.
Buenos dias, everyone. Asteria Vivas, community leader, activist, and outreach, and with the 25th Police District Advisory Council, as well as founder with Home Quarters and Friends. Buenos dias, good morning to everyone. Respectfully, I speak without disrespect. Since the beginning, other than March, in April, I share the importance of community updates, education, assistance about COVID-19, the funding that is being granted to help our community, and properly delegate tasks to city workers so that all residences and businesses are treated and assisted fairly. COVID-19 affects all parties, residences, even the ones that don't speak English, the ones that don't make the same income that you do, of different culture, religion, disabled, and the people that you don't like also, especially businesses, our local businesses. And I had to depict certain things because, as usual, when we're allowed to speak 5 and we're ready to speak, is reduced to 3, and the same 3 is reduced to 2. One of the things that I've mentioned in the very beginning is about assisting the local businesses, especially the local businesses, with PPE, with gear, with chemical, with signage, with disinfectant, with status, with education on COVID-19 and how the families are being affected. And then even after the updates and providing this information, if they do not comply with COVID-19, you close them down. But you don't come up with them, ticket them, when all of them are not being made aware of what's going on a day or week or month-to-month basis. Consistency is so big. The agenda, the announcements, the accurate financial report, being organized. And this is from all of our city officials. And when they had last week that long line on Broad Street that was so disorganized, no type of distance, no restrooms for them to use. I mean, it was so disorganized. How could you not have help in getting volunteers to have that better organized too? Today, more than some councilmen and women are not able to respond to our questions because of lack of information that they receive, even from our mayor, which I originally was supporting, because of cancellations and no rescheduling, and because of disrespect. How many people cancel because of weather? Virtual cancels. What does the weather have to do with virtual meetings? The disrespect, such as when I hear a few of you smirk when our councilman is busy speaking about concerns and the facts. How do you not effectively advise, report resources, supply accurate financial information, or how the grants were distributed to all council people, all council members, police officers, and community members? If you do not read all the emails and media messages and you work around these concerns, in my opinion, you don't care. City members, city officials, city workers, you guys are not mystical monkeys. You're not mystical monkeys where you're covering, some of them are covering their ears and their mouth or their eyes. This is, everything that is being talked about is relevant. Continuing to allow, when you do not work together as a team.
Testimony, please.
It questions us leaders about the city leaders itself.
Thank you for your
Please,
testimony.
please do not do what is preferred. Do what should be done, because our businesses, our homes, our lives are being threatened when it's not.
Thank you for your testimony. Clerk, would you read or please bring up our next person to testify? And may I ask, unfortunately, we are extremely time sensitive here. So I'm going to instruct clerk or tech staff, and I'm going to say this with all due respect. We're going to have to cut at 2 minutes in order to hear people's opinions. So please summarize all our testimony to within 2 minutes. Thank you. Our next person to testify, please.
Reverend Michael Robinson, Senior Pastor of the Greater Enon Missionary Baptist Church.
Thank you. Welcome, Reverend. Please state your name for the record, and you may proceed with your testimony.
Reverend Mike Robinson, Senior Pastor of Greater Enon Missionary Baptist Church. A quick and decisive decision was made to grant Philly Fighting COVID a contract to do vaccinations. How was Philly Fighting COVID logically chosen over a medical team, the Black Doctors Consortium, to facilitate such vaccinations? I want to read a quote from WHYY PBS that was from a January 31st article this year. I quote, "Across the United States, communities of color are being disproportionately ravaged by the coronavirus. Yet despite being nearly a year into the pandemic, race ethnicity for COVID-19 is still largely unaccounted for in Pennsylvania. The consequences of incomplete demographic information could be serious," experts said. "The lack of clear and concise racial and ethnic data could mean that potentially wider disparities go unnoticed, and that the programs and funding to address them go unplanned. Counties in Philadelphia region also are not collecting complete racial data for COVID-19 cases and vaccinations. What's the city's publicized," and that was an end quote. Now, my question, what's the city's publicized prioritization scheme to address the need for vaccination? In Philadelphia, of the 210,000 plus first doses of vaccines administered, how many were African American, being the highest at-risk population in the city? I also like to ask, of the 101,000 plus second doses administered, how many were African American? There's no transparency regarding public demographic data as to gender, age, ethnicity, and other demographic information of the 312,000 plus people that were vaccinated in the city thus far. I support Bill 200678.
Thank you for your testimony, and thank you for your time courtesy as well. Clerk, would you please read our next name for somebody to testify, please?
With all due respect, I just want to confirm that I do 100% support Bill number 200678.
Thank you much.
Roman Zukov, President of the Northeast Philadelphia Connected.
Can you hear me now? Good morning, everyone. My name is Roman Zhukov. I'm the president of the Northeast Philadelphia Connected and appear today in support of Bill 200678. I appreciate the opportunity to appear before Council today and offer my views on this very important piece of the legislation. The past year has been one of the extreme distress for all the residents of Philadelphia caused by the effects of COVID-19 on the health and safety at all. Things have been made even more difficult because the mayor and the departments have not done an effective job on communicating with the Northeast Philadelphia community with respect to the gathering restrictions, business closures, vaccine distribution, etc. This bill seeks the remedy that shortcoming by requiring the current administration to communicate more effectively with the City Council, which will allow our representatives on Council to provide better and timely information to its constituents. It has been very difficult to get information regarding quarantine or business restrictions. A business in Montgomery and Bucks County sit across the street from those in the city, and the city businesses have been subject to harsh enforcements at times without city officials being able to explain why restrictions are enforced differently in adjacent counties, like sitting next door to each other. Also, I find it difficult to work 2 jobs and still try to survive, and provide virtual education to my children who are enrolled in Philadelphia school system. Our schools remain closed while some of those adjacent counties are open, and private Catholic schools are open and thriving. The city and the school have not offered any common sense explaining why this is the case. Other than buildings and the city are equal or same age, are open, and the age of the system is a valid or not valid excuse for a reason those schools are closed. Philadelphia electorate needs answers to those and other questions related to recovery from COVID-19. The administration has not held many effective press conferences to keep both county and the city informed. We need to know who is responsible for what, instead of calls, hotlines, talk to somebody and somebody's, that's not my job. There is no responsible party. There is level of frustration is considerable. I would like to, pretty much from the personal opinion, I have to work 2 jobs to take my son to the Fisterville so he can go online to the school so I can support his education. Locally, there is nothing to help him or me or to answer any questions. I appreciate your time. Thank you for hearing me out, and I hope it will be resolved.
Thank you for your testimony, and again, thank you for your time courtesy. Clerk, would you please read the panelists for panel 3 who are going to testify? And again, I want to state for the record, at 2 minutes, I've instructed tech staff to cut off the conversation publicly. Clerk, would you please read the panel?
Matthew Rossi, owner of Nick's Roast Beef. Nick Shinoy, president of Asian American Chamber of Commerce of Greater Philadelphia. Sean Solm, general manager / talent buyer of Voltage Lounge. And Anatoly Kenis, board member of the Liberty Bell Small Business Association.
Our first speaker, please.
Matthew Rossi.
Please state your name for the record, and you may proceed with your testimony.
Good morning. My name is Matthew Rossi. I'm the owner of Nick's Roast Beef in Northeast Philadelphia. I have locations in Councilman Heenan's district and Councilman O'Neill's district. I, along with every business owner I know, have spent the better part of the last year attempting to survive the unprecedented times we are still going through. A pandemic unlike anything any of us have ever seen in our lifetimes. We are all in positions none of us could have ever expected, and most had a tough time trying to get through. With that acknowledged, I think we all did the best we could on our own, together, and with community support, and with what should have been strong support from our elected leadership in the great city of Philadelphia. Again, circling back to that word unprecedented, most people did the best they could. I would like to believe the mayor and his advisors attempted to make the best decisions possible early on in the pandemic to look out for us in masses. This includes all aspects of the population. Obviously, public health is number one concern throughout the last year, but there is still a large responsibility to manage things correctly, not infringe on people's rights, and operate the city under the correct parameters within the guidelines in front of us. This includes following the proper steps of legislature in order to make sure the citizens of the city feel as though their needs are being considered by the people we elected to govern. That seemed to be one of the biggest issues we faced over the last year. With no ability to go to hearings or have a voice, the average person has felt like the powers that be were just telling us what they wanted. And by continuing to re-up the emergency management and control of the mayor, there has been no end in sight. City councilwomen and councilmen are elected to each district to represent the people that live and work in that district. In not involving council in these decisions, the only voice we had was silenced. If there is nothing wrong with these decisions and the way they are made, then there should be no reason to bypass the proper legislative procedure. I would think with so many different angles of chaos surrounding us in the city of Philadelphia, great leaders like the mayor would want as much support as possible from the people around him in order to make the best decisions at all times. As in any walk of life, sometimes things can be overlooked. And having 17 members of the panel stand in front of to ask, what do you think, seems like it could have been a great way to make the best decision possible for as many actual citizens as possible. In closing, I'd like to thank you all for the tireless work you've put in doing the best you can, everyone that you represent. I know there can't be many decisions that come easily, and certainly don't envy any of you that sit in this position any day. Hopefully, the passing of a bill such as this will help continue to maintain order and show people of the city, no matter who you are or what your lot is in life, the people we have elected are always looking out for us. Thank you for your time.
Thank you for your testimony. The chair now recognizes we are joined by our chairwoman, Council Member Cindy Bass, who will be convening the chair. I'm going to step down and assume the vice chair role and participate in the meeting. Council member, thank you for taking over and joining us.
Well, I want to thank you, Councilmember Heenan, for all of your hard work and for filling in while I attended to much important city business at this time. So I thank you for working through all of the testimony that we've had today and for making sure that the people of Philadelphia feel heard regarding this particular piece of legislation. So I thank you. We're going to proceed and we're going to go. I know that we have a hard stop at 12:30. We want folks to know that in no way, shape, or form do we intend that hard stop is in any way disrespectful or an attempt to not hear from folks. But what we want to make sure that folks understand is that as we get closer to 12:30 and the mayor has reserved time on the cable access, we are required to make sure that as we give testimony, or as we hear testimony, that the public knows everything that we are hearing. And so as a result, we must stop accepting testimony at the time when we are no longer broadcasting. And so to be in compliance, and we want to be in compliance at all times, we do not want in any way, shape, or form for folks to think that we are hearing testimony and making decisions with information that you have not received. And so that being said, I know that Councilman Heenan suggested this before. I'm going to suggest it again, that if we want to make sure that the bills that you care about get out of committee today, then we do need you to stick to the 2-minute rule on the timer and to limit your testimony to 2 minutes or less. I think that there's been a lot of testimony from what I've heard thus far that reiterates the same thing. We want to hear from you, but if you feel like the sentiments of your testimony have already been suggested or have been put out there, then let's proceed and hear the next testimony until we get through it and we can have a vote. We need to make sure we have a vote today, and we have another bill which is going to be after this one. So all of that being said, I'm going to be quiet now so we can get back to testimony, and I ask Madam Clerk to please call the next witness to testify.
Nick Shenoy.
Good morning, Honorable Councilmen and women. My name is Narasimha Shenoy, also known as Nick Shenoy, founding president of the Asian American Chamber of Commerce. I have provided the written statement. I will summarize it. We are a membership organization with 13,000 Asian businesses. 97 of them are employees. You know, before the COVID, our businesses were hurt by the riots and lootings, and the COVID on top of it has made it worse. The transparency has been a very critical issue, as we have to get all the information from a council member we work with, and it has not been very easy. I think November 2020, the joint diverse chambers submitted a letter to mayor and to the health commissioner expressing the concern. It's a part of this testimony I've attached to it. On distribution of vaccine is also for us lacking transparency and oversight. One of our member parent basically is 90 years old. He has no clue when he's going to get it. There seems to be no priorities. So that's another concern we have to our membership. Finally, we understand the health commissioners and mayors issue to order to keep us safe. We expect such orders to have severe economic consequence to our businesses and employees. We support this legislation, which requires the administration to come to City Council and provide the data and information that justifies continued emergency measures. Administration needs to integrate the impact of effective vaccine campaign with future restrictions that will be placed on businesses and the lives of the citizens. After independence, police protection during the summer riots also damaged businesses. The city then needs to place restriction on business operations, the impact. Our business community deserves better from city leadership. This concludes my testimony. Thank you, Councilman O, and the committee for providing me the opportunity to speak in favor of this bill. Thank you very much.
Thank you for your testimony. If we could have Madam Clerk call the next witness to testify.
Sean Salm of Voltage Lounge.
Good morning, Council Chair and committee members. My name is Sean Salm, General Manager and Talent Buyer of Voltage Lounge. I'm testifying today in support of Bill number 200678. I'm going to summarize due to time restraints. My full testimony is submitted. Thank you for allowing me to provide testimony on this. Is the first time I'm able to address my concerns about the city's COVID restrictions since the mayor declared an emergency. Always thanks to David O and his office for lending an olive branch and continued support for our city's independent live music industry and providing me this platform to tell my story. March 12th marks 1 year since we've been able to operate at full capacity. It's been a whole year. Venues were the first to close their doors, and we will be the last to reopen. Our local live music industry employs thousands here in the city, from bartenders, ticket takers, production sound staff, even small scale rooms such as Voltage has a staff of 20 plus employees in regular rotation. Economically, we boost local businesses and
mission to promote the well-being of Asian American seniors and other adults who are disadvantaged by language and cultural barriers. We're proud to do that work in our East Oak Lane neighborhood of Philadelphia. And I'm pleased to share this testimony in support of Councilman O's Bill 200678. While we're deeply appreciative of the administration's leadership during incredibly difficult times in which the cities needed clear, trusted voices, and we recognize that Mayor Kenny and Health Commissioner Dr. Farley have been those voices, we also think that this bill recognizes that council's close involvement in the city's continuing response to COVID-19, being kept fully informed and with a voice in administration's plans, can only serve to further improve city leadership. PASI programs empower independence, allowing seniors to continue living at home in their chosen Philadelphia community. Our adult day centers have been closed since the city's emergency order went into effect nearly a year ago. While we understand that there are many complex factors that must be taken into account when considering reopening, for our senior clients, even just 1 month of inactivity can lead to serious long-term negative health consequences. As a result of these extended ADC closures, some of our seniors who had previously been in relatively good health have now regressed significantly. Without prompt reopening, some may never make a full recovery. We're also thankful for the city's efforts to roll out vaccines. However, we want to recognize that there have been significant complications with the rollout of vaccines for our site, for our 1A direct care healthcare workers. While we thank Commissioner Farley for his assistance in initially setting up a vaccine clinic, we recognize that those plans eventually fell through, and we haven't heard back from the city since that point. So all of that to say that we share this in full knowledge that these continue to be difficult times, and there are still a lot of unknowns. However, whether with business reopening schedules or with vaccine administration, even if nothing had been changed about the underlying decisions that have been made, increased clarity of communication would have been of great benefit to our stakeholders. We feel that City Council's inclusion in the decision-making process would be a significant benefit to all city stakeholders. Thank you to the committee. Thank you, Chairwoman Bass, for this.
And we thank you for your testimony. Madam Clerk, if we could have you call the next panel of witnesses.
Chris Borderland, President of Somerton Civic Organization, Susan Siegel, Community Leader of Mount Airy, and Irene Tabach, Philadelphia business owner.
Good morning, Chairwoman Bass and members of the committee. My name is Christopher Bordelon, and I've come before you to testify in favor of Bill 200678. I'm an attorney by occupation, and I'm testifying on behalf of the board of the Somerton Civic Association. Somerton Civic is a membership-based nonprofit civic organization that operates under the direction of an all-volunteer board that advocates for our neighbors in Somerton and far northeast Philadelphia in the 10th Council District. I volunteer as president of Somerton Civic. Now, given the shortness of time, I'm going to submit my full testimony for the record, and I would caution against taking isolated parts of it out of context. Last Friday, February 26, Dr. Anthony Fauci reportedly urged that states and local governments wait before easing the restrictions they have in place. Yesterday, March 1st, the director of the Centers for Disease Control and Prevention, Dr. Rochelle Walensky, issued a similar warning. She said, and I quote, "I am really worried about reports that more states are rolling back the exact public health measures we have recommended to protect people from COVID-19. Both Fauci and Walensky expressed concern about the coronavirus variants that they worried pose a serious risk of a fourth surge in coronavirus cases. Yet, as of yesterday, the city of Philadelphia acted under the direction of its health department to loosen its coronavirus restrictions. Dr. Thomas Farley reportedly described himself as optimistic and said that led him to loosen occupancy restrictions on businesses and venues. Now, there may be good reasons for this apparent disconnect between what the city did and what federal officials were advising should be done at the very same time. But under existing law, as interpreted by the administration, the reasons why the administration chooses to impose a specific set of rules at a given time do not have to be explained to the satisfaction of the people of the city or to their representatives in city council. The recent changes to the coronavirus rules is the most recent iteration in a pattern of activity that has persisted throughout the pandemic. The city administration announces changes to its restrictions without providing an adequate explanation as to why the restrictions that are imposed at a given time are the right ones. By creating an opportunity for members of city council to receive an explanation of health restrictions imposed by the city administration, to ask questions and to expect answers, this bill would bring about what has become an overdue return to a system where not only the executive branch of city government, but the legislature, city council, has an important role to play in making laws that have serious consequences for people's lives. The law that gives the health department authority to issue binding rules is designed to meet an emergency. Section 6205 of the code is entitled Emergency Epidemic Control. The department's action under that law is based upon the need to act immediately, a lack of time for deliberation, and the suspension of normal rulemaking based on the presence of an emergency. The coronavirus pandemic is a health emergency for sure, and may remain so
Chris,
for some.
I'm sorry, I'm going to have to cut you off. I do apologize, but you did say that the rest of your testimony was going to be submitted for the record, and I can assure you that every member of council on the committee will receive it and we will review it. So we are going to have to wrap up your testimony.
All right. Thank you, Madam Chairwoman. I will submit that, and I urge you to support the bill.
Thank you very much. Madam Clerk, can we have you call the next two witnesses to testify on panel 4?
Susan Siegel and Irene Tabach.
Yes, I'm here, Susan Siegel. I support this bill, but I need to say that I'm a senior citizen who was able to get a shot only because my internist at Penn Medicine. Had it not been for them, I applied to so many sites and got no response. So at 77 years old, I need to have a shot. And I'm grateful that the people of Penn Medicine tried to get all their patients vaccinated, as many as they could. And I appreciate what David's doing, because I think we need to really be clear to the citizens of Philadelphia about what's going on here. I relinquish my time. I just wanted to say that.
Well, thank you very much, Sue. We really do appreciate it, and we appreciate hearing your comments about your experience. So I do thank you for that. Madam Clerk, can we have the next witness to testify if she is, if they are available?
Irene Tabak.
Good morning. Can you hear me?
Good morning. We hear you well. Please state your name for the record and begin your testimony.
Great. Good morning. My name is Irene Tabak. I'm here to testify on bill number 200678, which would give City Council more oversight over the health department and COVID-19 restrictions. I'm a member of the Liberty Bell Small Business Association and a landlord in Philadelphia. My husband is a disabled military vet. We have been active members of the Philadelphia community since we immigrated here in 1970s. In the past year, we have exhausted ourselves physically and mentally, trying to reach the governor and the mayor to seek input and guidance regarding our hardship. And the only input we have been given is to write letters which have gone unanswered. Small business owners like us are being left behind right now. My husband and I have utilized our military pension to invest in a few properties around the city. As responsible landlords, we continue to pay taxes, mortgages, and utilities. However, our working tenants who did not experience hardship due to COVID refuse to pay any rent because they do not have to, and we have no recourse. We're struggling to keep afloat. The courts are not evicting tenants, and I'm left with a choice to ruin my credit and lose my savings. I'm also very disappointed by the health department's complete lack of organization regarding vaccination distribution in the city, particularly for high-risk elderly population. I have tried to register my father, who's very high risk, for weeks and have made no progress. I can't imagine what those who do not have the means that I do are going through. Thankfully, I have the time to sit on hold for hours just to be told that they have no answers. What about those who can't? There's no cohesive guidance, and people of the city are being left in the dark by those who are supposed to be taking care of us. I am simply asking that my elected council people, representatives be informed and involved in the COVID restrictions and future planning and the realities of how people are struggling. We need more support. Please support bill number 200678. Thank you.
Thank you, Irene. I appreciate your comments and for you letting us know about your experience. We thank you for being here today to make sure that we have that information.
Thank you.
If we could have, absolutely. Madam Clerk, can you call the next group of folks who want to give public testimony?
Jennifer Bennett, Bridget Powell, and Andrea Lawful Sanders.
Do we have Jennifer available?
Yes, I'm here.
Hello, Jennifer. Please state your name for the record and begin your testimony.
Hello. Jennifer Bennett. Yes. I guess I'll start by saying that I always like to say Philly is a big city that is full of small town corruption. And this hearing has really shed light on the fact that that is Philly, a big city with small town corruption. It's like the health department and the city agencies and the managing director's office are here fighting for their ability to dictate over our lives without any checks and balances. It's like we have a city council, but the mayor seems to have some kind of full executive authority over everything. And that's what really needs to be brought into question. The mayor appoints all of the commissioners. The mayor appoints all of the boards of our city departments. He appoints all of our managing directors. And these people really all have the full authority over our lives. And just to sit here and hear council members, coach, health department employees to say the right things, to make it as if this resolution should not be approved, to see this health department fight so hard against just being transparent and accountable to the citizens of Philadelphia, it's just not good. It's really just disgusting. And it's the same with all departments. Like if you're having an issue with the Office of Homeless Services or the Housing Authority or the prison system or any of these city systems you're going through, and these council people, and I had my times where I was really mad at council people, but then you learn how it works and you're like, wait a minute, they really don't have any authority over these departments that are able to reap all the benefits of being a government agency and get funding from the city and have all this power, and then there's no check and balance on that. So I think that I support this resolution, and I hope that it kind of can set a precedent for having some more checks and balances on a lot of these city agencies, because the city can't go on like this. We're electing our leaders, and then they have no say-so or no authority to call these people in and make sure that they're accountable to the people that they represent. Thank you.
Thank you for your testimony, Jennifer. Always, your voice is appreciated. Sometimes we agree to disagree, but always has, a perspective that needs to be heard and listened to. So we thank you for being here today. Our next speaker is Bridget Powell, as per the clerk. Is Ms. Powell available? Is Bridget Powell available? No?
I am.
You are?
Can you hear me?
Okay, very good. Please state your name for the record and begin your testimony.
Good morning. My name is Bridget Powell, and I would like to begin my testimony.
Please proceed.
Thank you for hearing me today. As a public health care professional and a school nurse of 25 years in the city of Philadelphia, I plead with this committee to ask you to pass the bill 200678. I do public health daily, and what I'm hearing that the mayor and Dr. Foley are asking for, emergencies arise, but this is not something that requires us to act within minutes. I deal with emergencies every day as a school nurse and as working in the hospitals for over 25 years. I have never found that the members of City Council were unreachable, so I find it hard that the mayor and Dr. Farley want to bypass them. Just yesterday, I had a student call me at 7 o'clock in the morning just to reiterate what I asked her to do to get her vaccination, which is a school requirement. So we as healthcare professionals are readily available. I feel like City Council is readily available. So I see no reason why we should not pass this bill 200678. Thank you for allowing me to testify.
And thank you for your testimony. We appreciate your perspective. Madam Clerk, can we have you call the last of those who are here to offer public comments? I think it's Andrea Lawful Sanders.
Yes, Andrea is our last panelist.
I'm here. Good afternoon. Good morning. What time is it? I don't even know.
It's 11:56.
Okay, so it's almost afternoon. Good afternoon. This is my first time actually calling into any city council conversations that you've been having, but it meant enough because I had been watching what's going on around the city as it applies to the health department, Dr. Farley, Black Doctors COVID-19 Consortium, and the mayor of this city. After watching the Philly Fighting COVID debacle that took place, and then recognizing the tone deafness that remained consistent throughout everything that was going on in this city, I'm in here to tell you that I completely support what you're about to do. Somebody needs to have some kind of oversight over what is going on in the city department, because it got so bad that FEMA called yesterday onto my radio show. I said to them, what are you doing? They said, well, we're the federal funders. We're bringing the funding into the city. The city and the health department is managing what's happening with the vaccinations for the next 8 days, from 8 to whatever, for the next 8 days. And I find it very difficult that City Council may not have any input into what is getting ready to happen. We called 311 47 times before we got through. When we finally got through to 311 says, no, you're not supposed to call us. You're supposed to call down to the convention center, and then the convention center will call down to the health department, the city health department, and then the health department will tell you what to do. Do you see the cluster that's going on here? And so I really need you all to figure out how to have some more oversight over what is happening here. I am very concerned about what's going to happen with this city. It would be nice for businesses to open if we could get the mayor and Dr. Farley, who I have to tell you on the record, I have absolutely zero confidence in at this point, right? Can get together to figure out how to serve this city in a much better manner. I thank you all. I'm yielding the rest of my time. I appreciate what you all are trying to do. And if there's anything else I can do to get involved in making sure that the people of this city get what they need, I am more than happy to be a part of it. Thank you.
Ms. Sanders, I thank you for your testimony. I have heard you on many occasions And I know that you have a strong voice and advocacy for the community. So I thank you for being here today. Madam Clerk, is there anyone else to testify on this legislation?
I believe that's the end of the witness list.
Okay, so I'm going to ask, is there anyone else here who wanted to be heard but was not heard regarding this testimony? Anyone who wanted to speak but was not afforded the ability to say their viewpoint on this bill, please speak up now. And so if not, we are going to take a brief break for 1 moment. Please pause for 1 moment while we conduct some council business. 1 moment.
Mobile device not found. Ready to connect.
public conversation and vote on this particular bill, I want to recognize Councilman David O. For further comments.
Thank you very much, Chair. It is now time to vote on the bill. I do have an amendment. I will say that I understand people have different perspectives. I would like to point out that this bill in no ways slows down or stops the work of the health department. If we don't meet, they keep working. If we don't vote, they keep working. They don't have to come up before us for each and everything they do, as they have somewhat intimated. That's completely false. But they do have to come in front of us to justify what they've done, why they're doing it, and what they're going to do in order to continue their emergency powers. Without their emergency powers, they continue their work. Without their emergency powers, we're still subject to the emergency powers of the state. When they differentiate themselves, when they go against the federal government and the state, they have to explain to this body what they're doing and why, but they continue to work. If they cannot justify themselves to you, the members of this body, then you will stop their emergency powers and they will continue their work without it. However, if they justify to you why they have emergency powers, then grant them an extension. That's how it's done. The people, I think, are very much looking for someone to hold accountable and to talk to, and that would be us if we have the power to get the answers. I'm telling everyone, I don't have answers. Yeah, I sit on all those briefings. I have no answers, and we don't have them today. And the reason they're in front of us is because we might exercise powers over them. Thank you very much, Madam Chair.
Thank you very much, Councilman. Were there questions for members of the committee? Councilman Green?
Yes, Madam Chair. Could Councilman O explain his amendment?
Yes, I will. I originally introduced the bill with 60 days, and in talking with the administration, I extended it from 60 days to 90 days to give them more time to prepare their report before council.
To follow up on that, Madam Chair, Councilman O, when you said you spoke with the administration, did you talk with the law department in reference to the legislation, and what was their perspective on your legislation? Wait, hold on, let me finish my question. Did you receive a solicitor's opinion regarding your legislation?
Yes, I did.
Okay, and are you at liberty to share, I know attorney-client privilege with a solicitor's opinion?
Yeah, I certainly can share. They made some technical amendments, which we agreed to. They made some recommendations, which we agreed to. One of the things they wanted was timing-wise to go from 60 days to 90 days, and that's what we did. They raised the issue of the fact that we can, as City Council, amend this section that's within our right and power. They raised the question of whether it would have any effect, since there's an issue of whether or not the powers of the health department in this case are derived from the state. They did not give an opinion that we can or can't do this in an effective manner. Their legal opinion is we can amend the code. The question is, does it have any effect? What I did was I contacted the state to go to their research department. What they returned to me in an email was that since the state only authorizes the city to create a local board of health or a health department and does not provide any other limitations or guidance other than it cannot contradict, not that it cannot contradict, it cannot do less than what the Commonwealth health emergency powers require, cannot do less than, it can do more than. But if it is not effectively addressing the emergency, then the state has the power to come in. So the opinion I got was there's no reason why we cannot, in accordance with state law, create this requirement to report to council. And by the way, it exists in Pittsburgh, so that's not a violation of state law.
Well, Pittsburgh is a city, and we were talking about Allegheny County. My question is in reference to whether that was from the General Counsel's office, from the Department of Health, or what entity within the Commonwealth provided that opinion? Was it a legal opinion, or was it a perspective from a health department official?
It was a researched opinion. In other words, it was given to technical staff in Harrisburg, and that was provided to me in a short answer. So I cannot say where it came from. I only got that through an email from what I understand to be their technical department, referencing the bill or the section that I read.
And was that from technical perspective from the Legislative Reference Bureau, or from a state senator or House member's legislative staff?
My request went through House representative to make a request to the research department, and that is the answer that I got back. Title 35 and the subsection that I read, which is the only section that establishes an authority to have a local health board.
And which state representative did it go through?
Went through Martina White's office.
State Representative Martina White.
Yes.
Okay. Yeah, because you, in your opening statement, you made a number of comparisons with the request made by the General Assembly and concerns regarding the legislation that has been introduced and discussed in the General Assembly regarding Governor Wolf. I will just state for the record, just like a number of other statements have been made regarding concerns that we've had with the health department, that I've had with Dr. Farley, that I've had with, quite frankly, the statements coming from the administration. But my concerns regarding the vaccination, the challenge we had in getting Dr. Eli Stanford to get funded by the city based on the own funding that we've done through our own transfer ordinance that we did at the beginning of this pandemic, as well as the woeful selection of Philly Fighting COVID, as well as my own press conference that I had, along with, a press conference that I participated in, along with other members of council, based on the work of Councilmember Dom, looking at other locations. My concern that was raised and continue to be raised based on the beginning of this conversation, there are certain entities and elected officials in the Commonwealth that have had some strong opinions regarding the steps that Governor Wolf has taken in reference to the actions that he has done from a emergency perspective in order to save lives through his health commissioner, health secretary, who is now at the federal level, as well as similar concerns I've heard at the federal level, and that's come from, unfortunately, from a partisan perspective. And I'm concerned that some of the same arguments I've heard are also part of some of the conversation I've heard today on this legislation. And so that's why I asked this question in reference to some of the information you received and the methodology how you received it.
Sure, I'll answer that very quickly. I didn't raise those issues. That was raised by Chief of Staff Jim Engler, making a comparison.
Point of information, Councilman O, when I said my initial statement, you made reference to Governor Wolf and legislation being done at the state level regarding some of the executive orders. So I was referring to your opening statement regarding some of the steps that were taken at the state level. And those steps that were taken, that legislation was done by members of your party in reference to some of their concerns regarding Governor Wolf and his executive actions. And he was doing those based on his attempt to protect people from COVID. I made my statement based on your opening statement because of some of my same concerns that there are some similar perspectives that I've heard in reference to what is before us today. Not all, because some of the other concerns that were raised are very legitimate regarding some very significant concerns that echo some of the statements that I've said as well regarding how this administration has done things in reference to the pandemic, from very legitimate fear that a number of people have. And I agree with those perspectives, but those concerns are different than some of the dynamics in reference to addressing the issues of executive power and what some would say overreach from a very real pandemic that unfortunately has been painted in a partisan brush. And I've heard some of those echoes in today's legislation.
Okay, I'll answer that. You don't have to worry about that because this city is 8-1 Democrat. We have a Democrat mayor. We have all Democrat elected, citywide officials. We have a Democrat council president. We have 14 Democrats and 1 Working Families Party, and we have 2 Republicans in council. So I don't think there's going to be a partisan basis for the vote of a majority of council. This council typically does support the mayor. The issue here is that the governor sets the emergency powers. We cannot do less than the governor. We can do more restrictions, and we can deviate more or less, and that's been an issue. However, just as in Pittsburgh, that has a Democratic mayor and a Democratic council, the council is engaged and does have to extend emergency powers, because what happens when the mayor claims emergency powers, he disengages the regular process. This emergency, this pandemic is going into over a year, and council has not been, and the boards and commissions have not provided the citizens the regular processes of communication. And quite frankly, I'm just speaking for myself, I don't have the answers that I need, and I don't believe the public has the answers that it needs. And I believe that the administration and the health department should come before us and explain what they're doing. And that way the council members can approve an extension or not. Thank you.
And I would just to concur, just to reply to that comment. I know Councilmember Brooks has a comment and we're at 12:16, so I don't want to belay this point. And I agree with those issues and concerns. I've been very frustrated in reference to Philly fighting COVID, having to work with colleagues to fight to get money to Dr. Eli Stanford, which has now occurred. Been concerned about a number of issues, but we're dealing with a global pandemic, something that we've never heard or seen before. Because I am involved in different organizations at a national level with the National League of Cities, Democratic municipal officials, and the Pennsylvania Municipal League, I've heard some of the same concerns from cities around the Commonwealth as well. But at the same point, just because we have some issues and concerns regarding a health pandemic that we have never seen before, I also don't think we should be using this as an opportunity to echo some of the same dynamics which I've heard at the federal and state level. I think there are 2 different issues totally. And the fact that what I'm hearing is based on your initial conversation, your initial statement about the legislation done in Harrisburg gives me some concern. Yes, this is a Democratic city. We have a majority of Democratic elected officials, but the issues and perspective that I'm hearing, and based on the source of information that you provided, which came through the chair of the Republican City Committee, causes some concern of echoing some of those same sentiments that I've heard in Harrisburg and as well as in DC. Thank you, Madam Chair.
Thank you. There's not been one, to my knowledge, there's been no Republicans who testified on behalf of the community. They are the voices of the community.
Information, Susan Siegel formerly worked for Senator Arlen Specter.
Oh, okay, I don't know that she means she's a Republican or not. Let's say she's a Republican, but I'm pretty sure everybody else who testified with a lot of anger and vigor were not Republicans.
Anger and vigor, legitimately, in reference to what happened, in reference to the information and the lack of information we're receiving, because we are all going through a very challenging dynamic that we all fear of, a pandemic that's taken over 500,000 lives. That is totally understandable, and we all have concerns and fear. But taking that perspective and then tying it into some of the perspectives that I've been hearing at the federal and state level, I have some real concerns. And it seems that you opened a conversation regarding legislation that started in Harrisburg in reference to Governor Wolf's executive power. And some of the arguments made based on that perspective come from a partisan perspective of those who, at some point this last year, didn't think that this pandemic was much more than just a common cold or a flu. And that was my concern. Thank you, Madam Chair.
Well, I want to thank you for your comments. Well, first of all, let me ask if anyone else has anything else that they would like to add on the committee. Any other comments from the committee?
Chair Bass, I would like to, I didn't know if I was going to have time to kind of jump in and
Councilwoman Brooks, Chair recognizes Councilwoman Brooks.
Okay, excuse my background. I'm virtual schooling here with my grandchildren, so
That's perfectly fine.
Okay, so I would like to kind of address some of the misinformation that I felt has been circulated today about exactly what this bill would do. I heard the comments from everyone that testified today, and I want to thank them for all their comments, but I don't believe the bill, even as amended, would provide us with the oversight that has been asked for by the members of the public and that we've heard today. And I understand the people's frustration, and I share many of those same frustrations, but I don't think this bill would address those frustrations. And to Councilmember Green's point, the same strategy that's being used by Republicans in Harrisburg to block the governor during this time of emergency, I can't support that effort here in Philadelphia. So because of my own concerns, as well as the city solicitor's comments about the impact of this bill, I can't support it. And I do believe in working towards greater transparency with administration moving forward, but I think we should find another way to do it alongside with other council members and my colleagues and council leadership. But I just think a lot of information has been shared here, misinformation, and I just want to put on record that.
Thank you for your commentary. Is there any additional comments from members of the committee? No? Okay. So we're going to go ahead and go into a vote. And I do want to say before we go into the vote that I'm going to support the bill. I'm a yes for this bill because I think that you can't let the good stand in the way of the perfect. So we have, if we really want to have transparency, if we really want to have, a bill that's going to basically say to the administration, we want to work together. Let's work together. Work with me. I want to work with you. The only way for that to happen is to get it started. Somewhere along the line, we have to get it started. And I know that there is some concern about, partisan politics falling in. I really don't see that here. I'm a Democrat all the way through. I've been a member of, every Democratic apparatus you can think of. And there's no way, shape, or form that I would ever think that this would be used as a partisan attempt to undermine the mayor or city council. I just don't see it. So I wanted to put that on the record, and now we're going to go ahead and move forward and call for a vote. And that's just my opinion. I understand everybody's got their own opinion, but I wanted to be on record as to where I stand on this particular piece of legislation. That being said, I'm going to. Was there anything else from the committee? Chair? Yes, Councilman Green.
Councilmember Thomas has a point.
Okay, I just want Chair recognizes Councilman Thomas.
Yes, thank you, Madam Chair. Yeah, I just want to offer perspective, just, again, after listening to the hearing and listening to everything involved and also reading the bill, I actually think it is some partisanship involved. I think, number one, the bill doesn't require the administration or the executive branch of government to meet more than what they've met with us as it relates to our ability to call public hearings. Number two, based on Councilmember Green's line of questioning, we actually do not know if we have legal precedent for the bill to be introduced as it relates to our city and our county as written because of some of the technical issues that's already been introduced. So I understand Councilmember O's frustration, and I think I've said that throughout the hearing. And I think that his frustration, along with the comments from the public, as well as the outrage from council consistently, shows that there are some things that are going on that we are 100% sure that's wrong. But again, I too, like my colleagues, I'm questioning a lot about the bill. And again, I think it could set a precedent that I personally am uncomfortable voting for. I commend Councilmember O. I even told him if need be, I would be willing to second the bill for him because I think that he is communicating the frustration of a lot of people. But whether he intends to or not, and I think what you're saying, Councilmember Bass, is that he doesn't intend to do this as a means of partisanship. But I think what some of us are concerned about is that the precedent that it could set and the support it could offer to state legislators who do not have the same intentions as Councilmember O. So thank you, Madam Chair. And I'm sorry, I just wanted to add my comments for the record as well, too, because I will not be voting for the bill.
Okay. All right. Any other comments before we take a vote? It's 12:24. We have to be off the line in 6 minutes, so we need to move it along.
Now,
Councilman Green.
If I just make one final comment, I want to thank Councilmember Tom for that comment. And also, I do want to say to Councilmember O, I appreciate him raising this issue. It is an issue we continue to address. I do feel that the administration has not been as forthcoming in providing information to us as a body. But at the same point, although I am part of this board of governors, which is city council, I'm also not a physician. My sister and I both graduated from law school, med school the same day, but there are issues and information that Dr. Farley has at his disposal that we do not has as a legislative body, but executive branch has. And I do believe they need to be more forthcoming with information to answer the real questions that people have. But I will close that.
Yeah, I apologize, but it's 12:25 and we have to have a hard stop at 12:30. But I get your point. I certainly understand your position here. So that being said, we're going to go ahead and move into the vote for this particular bill.
Councilmember, I just want to confirm that I'm present.
Okay. All right. So we'll do a final roll call. Madam Clerk, can we do another roll call to establish a quorum?
Councilmember Heenan.
Present.
Councilmember O.
Present.
Councilmember Gim.
I am present.
Councilmember Green.
Present.
Councilmember Thomas.
Present.
Councilmember Brooks.
Present.
And Chair Bass.
And I am present. I want to thank you, Madam Chair. A quorum of the committee is now present, and the chair wants to recognize Councilman Heenan for a motion to the amendment on bill number 200678.
Thank you, Madam Chair. An amendment to bill number 200678 has been, I have offered an amendment to bill number 200678. A copy of this amendment has been circulated to all members of this committee, and I move for the amendment of bill number 200678 be approved.
Second.
The chair notes for the record that Councilmember O seconds the motion. It's been moved and properly seconded that the amendment to bill number 200678 be approved. All of those in favor of the motion will signify by saying aye.
Aye.
Aye. Any opposed?
I approved. This is Bobby Heenan. I approve the
amendment.
The amendment.
Okay. So let's do that again, just to make sure everyone understands. We're voting for the amendment to bill number 200678, that it will be approved. All of those in favor of the motion for the amendment to be approved will signify by saying aye.
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 Okay. All those opposed? The ayes have it. The motion carries, and the amendment to bill number 200678 has been approved. The chair recognizes Councilman Heenan for a motion on bill number 200678 as amended.
Thank you, Madam Chair. I move that bill number 200678 as amended be reported from this committee with a favorable recommendation, and further move that the rules of council be suspended to permit the reading of this bill at our next session of council. Roll call, please.
Roll call.
We need a second. I need a second.
I'll second it.
Yep. Okay, it's been seconded by Councilman. Was that Councilman Thomas? Councilman. Oh, I'm sorry. I didn't get the second. For the record,
it was Councilman O.
Councilman O. Okay. The chair notes for the record that Councilmember O seconds the motion. It's been moved and properly seconded that bill number 200678 as amended be reported from this committee with a favorable recommendation, and further move that the rules of council be suspended to permit first reading of this bill at the next session of council. All of those in favor of the motion will signify by saying aye. Aye. Those opposed?
Nay.
No.
Can we have a roll call vote, Madam Clerk, if you could call the roll for the vote?
Councilmember Heenan.
Nay.
Councilmember O.
Yes.
Councilmember Gim.
No.
Councilmember Green.
Nay.
Councilmember Thomas.
No.
Councilmember Brooks.
No.
And Chair Bass.
Yes. Okay, so this bill does not have enough votes to pass. We have 5 noes and 2 yeses, and so the bill does not advance. That concludes the business of this committee for the time being. We do have another hearing coming up for bill number 210122. We are going to hold that meeting until 2:30 because we have a hard stop at 12:30, which it actually is 12:30 now. So we will start fresh at
Madam
2:30.
Chair, we're recessing the
Yes.
the Committee of Public Health and Human Services until 2:30. Is that correct?
That is correct. We are going into recess until 2:30 this afternoon, at which time we will hear testimony regarding bill number 210122, which was offered by Councilwoman Brooks. And so we are in recess and stand adjourned until 2:30 this afternoon. Thank you very much.
I think y'all made a big mistake not passing this bill, and y'all going to see that was a big mistake.
Madam Chair, council members and participants, we are now live.
Thank you, Modesto. We are going to go ahead and begin. And I'm going to read our public disclaimer as we proceed, which is that I understand that the state law currently requires that the following announcement be made at the beginning of every remote public hearing as follows. Due to the current public health emergency, city council committees are currently meeting remotely. We are using Microsoft Teams to make these remote hearings possible. Instructions for how the public may view and offer public testimony at public hearings of council committees are included in the public hearing notices that are published in the Daily News, Inquirer, and Legal Intelligencer prior to the hearings, and can also be found on phlcouncil.com. I now note that the hour has come, and Madam Clerk, will you please call the roll to take attendance? Members that are in attendance will please indicate that you are present when your name is called. Also, please say a few brief words when responding so that your image will be displayed on screen when you speak. Madam Clerk?
Councilmember Heenan. Councilmember O.
Good afternoon, Madam Chair, colleagues. I am back. Looking forward to the remainder of this hearing.
Councilmember Gim.
Good afternoon, Madam Chair. Good afternoon, colleagues, to our witnesses and testifiers today and to the public.
Councilmember Green.
Good morning, Madam Chair, colleagues. Looking forward for continued robust conversation.
Good afternoon.
Councilmember Thomas.
Good afternoon. I'm present.
Good afternoon.
Councilmember Brooks.
Good afternoon, Madam Chair. Good afternoon, speakers.
Good afternoon.
And Chair Bass.
And I am present. Thank you, Madam Clerk. We have a quorum of the committee present, and this hearing is now called to order. This is the public hearing of the Committee on Public Health and Human Services regarding Bill number 210122. Bill number 200678 has already been heard and addressed. Clerk, will you please read the title of Bill number 210122?
Amending Section 9-4116 of the Philadelphia Code, entitled Public Health Emergency Leave, to establish leave time for public health emergencies and modify existing provisions concerning the paid sick leave and make technical changes, all under certain terms and conditions.
Okay, very good. I'm assuming we have opening remarks from Councilwoman Kendra Brooks, the bill sponsor.
Yes, I do. Thank you. Thank you,
Certainly.
Person Chair. I'd like to make a few comments before we hear from all the panelists about the 2021 Public Health Emergency Leave Bill. Last year, Council passed the Public Health Emergency Leave to protect our city workers during a global pandemic. But that leave ended on December 31st of last year. As we know, the pandemic did not end on December 31st of last year, and our workers are in still need of protection. My apologies. Our workers are still in need of protections during this global pandemic. And for the last 2 months, our workers have been left out of mandatory paid sick leave. As cases decline and the vaccine becomes more widely available, there is much to be hopeful for. But with schools, stadiums, and restaurants reopening, we must continue to be vigilant. A successful reopening is one where workers know that when they come to work again, they will be safe and they'll be able to keep their families safe. And protecting workers is a good business strategy. And I would like to thank my co-sponsors to this bill for listening to the workers who have kept the city running. Council members Bass, Gautier, Gilmore Richardson, Gim, Heenan, Johnson, Jones, Parker, Quinones Sanchez, and Thomas. I'd also would like to clarify some confusion around this bill's, how this bill interacts with the federal legislation. Currently, employers who have voluntarily chose to provide COVID-19 paid sick leave to their employees are eligible for a tax credit. And this has been true since December of last year. Additionally, from its inception, this bill has exempted all small businesses with 50 or less employees. Also, we have also added a few amendments after feedback from our stakeholders. First, we removed the retroactivity clause, which would have provided payment to anyone who used paid sick time in January and February. Secondly, we expanded the generous employer provision so that businesses who already provide 80 hours of sick leave will not be required to provide any additional time under this bill. And lastly, we heightened the retaliation provision to prohibit employers' reduction in paid leave accrual or entitlement under existing leave policies after March 1st of 2021. What we know is the time to pass this bill is now. Our workers have been left in the cold during these winter months, and we cannot wait any longer for these protections. So I want to thank you so much, everyone, for being here, and thank you, Madam Chair.
Thank you for your opening comments. Are there any additional opening comments from members of the committee? Okay, seeing none. I'm just going to double check. Okay, we see no additional comments. And so, Madam Clerk, would you please call the first panel to testify?
Rich Laser, Deputy Mayor of Labor of the Department of Labor.
Good afternoon, everybody.
Good afternoon. Mr. Laser, please state your name for the record and begin your testimony.
Will do. Good afternoon, Chair Bass and members of the committee. My name is Richard Laser. I'm a Deputy Mayor for Labor for the City of Philadelphia, and I'm here before you today to testify on Bill number 210122. Bill number 210122 is an extension of the Philadelphia Health Emergency Leave Ordinance that was passed in June 2020 in response to the COVID-19 pandemic. The original bill sunsetted at the end of December 2020. However, as we are all aware, the pandemic is still impacting the lives of Philadelphians in countless ways. Today's bill will renew and in some cases expand upon the protections which expired at the end of last year. I'd like to thank Councilperson Brooks and the sponsor of this bill and all her co-sponsors for their leadership on this issue. Even though we are starting to see relief with vaccine distribution accelerating, Philadelphians are still coping with unprecedented hardships. In the middle of this pandemic, far too many of our neighbors go to work each day not knowing what will happen or if their loved ones will get sick. This bill, as proposed to be amended, will add a new section of the Philadelphia existing paid sick leave ordinance, which renews the requirement for public health emergency leave originally established in 2020 PHEL bill. If passed, this bill will require the hiring entities create a pool of up to 80 hours of emergency leave that covered individuals may use if specific conditions are triggered, such as exposure to COVID, care for a family member suffering from COVID, self-isolation due to COVID, seeking treatment for COVID or diagnosis related to COVID symptoms, care for a child at home due to school or daycare being closed due to COVID. This bill would also balance the needs of employees and that of hiring entities by acknowledging generous employers who are already afforded their workers similar benefits. I'd like to acknowledge all the work that has gone into getting the bill to the version we have today. There have been good conversations on all sides regarding drafts and redrafts, and I believe we have arrived at a place where the goals of public health emergency leave are workable. One specific item I want to call out as a positive is that the ordinance focuses on essential workers who do not have the option to work from home. It's these essential workers who have kept Philadelphia running over the long months of COVID lockdown, and we think it is appropriate that they gain access to these benefits. The administration supports this bill, and I'd be happy to answer any questions at this time. I also have Amanda Shimko, who is the director of the Office of Worker Protections, on as well, who helped work with this bill, and she's here as well to answer questions. Thank you, Madam Chair.
Thank you, Mr. Laser. Madam Clerk, is there anyone else on this panel?
That's all for panel one.
Okay.
Madam Chair, you're on mute.
I do apologize. Thank you very much. I do see that we have a question from Councilmember Green.
Thank you, Madam Chair. Thank you, Mr. Laser, for your work and testimony regarding this legislation and giving some perspective that the administration supports this legislation. I think this is important work and continuation of legislation that the sponsor, Councilmember Brooks, initiated last year that did expire at the end of last year. I have a question. I know you stated that the administration supports the amendment, but the bill has not been amended as of yet. So I guess my question is, prior to the amendment, what, if any, is there a financial impact to the city of Philadelphia with this legislation?
So before the Good and Generous Employer Amendment,
Mm-hmm.
Yeah, I think before the amendment, there would have been some financial impact to the additional time having to be given and whatever overtime cost would be for folks that would have to cover, employees not able to come to work for COVID-related issues. But with the Generous Employer amendment, the city would be considered actually over generous employer compared to the amendment. So, but yes, we would be exempted out because of all the leave time that we do offer our employees. I don't have the exact number on what the cost would be, but there was a cost to it.
Okay. And so with the amendment, that moves the city into what's considered the generous employer. I'm going to make sure I get the right phrase. The generous employer
Correct.
criteria.
Correct.
Okay. And then, and that's based on the fact that the city of Philadelphia provides time off based on vacation time and also sick time.
We based off the amount of sick time that we offer.
Right. Okay. Because the city only provides vacation sick. It doesn't use a paid time off perspective.
Right. We use administrative leave, sick, and vacation. We have those three buckets.
Okay.
They're not all combined, they're separate.
Right. And did you have any perspective, and I'm not sure if other members of the administration, either Mike Rashid, the Commerce Director, or others had any perspective on the legislation, and other stakeholders worked with you on these amendments for legislation in reference to any concerns, issues that may have been raised to try to get as many people as possible to support the legislation.
Yeah, I mean, we do. Usually when an ordinance comes through, we all affected departments we do sit downs with folks and we try to address concerns that each department may have. We did do that on this bill.
Okay, and so there's a consensus by the entire administration that they support the bill, support the amendment to the bill, and support the bill as presented this afternoon.
Correct.
Okay.
With the amendment, yes.
Thank you, Madam Chair.
Thank you, Councilman. Chair recognizes Councilwoman Brooks.
Thank you so much. I'm asking here, folks, so I have my grandchildren around, so I got a little just distracted real quick. But Deputy Mayor Laser, can you talk about what kind of protections have been available to workers who were impacted by COVID-19 since the expiration of the 2020 public health emergency leave? And have they been well protected as they were before December?
I mean, I'll defer to Amanda Shimko in my office, who does a lot of the operations of the Worker Protection Office, but I do believe there was there has been a lapse since the bill did expire till time. But I think, this bill will fill in that gap to help to pick up the slack. But we do have anti-retaliation language and all our other laws that we do promote. And Amanda, I know, is on if she wanted to add anything to that.
Sure. The lack specifically was the Philly sick leave, while covered for employers above 10 employees, is usually an accrual-based system and not a front-loaded system. So while folks did have access to the PHEL sick leave, or what we call our traditional sick leave, they would have started likely at a bank of 0 and been accruing about 1 hour a week. And that's sort of where the lack is. The need is now, and folks really don't get to their 40 hours until the end of the year. So there was a big gap.
Thank you. I don't have any other questions, Madam Chair.
Okay. Any additional questions for Mr. Laser or the Labor Department? Okay, I don't see any other questions in the chat. And there being no one else from the administration to testify, Madam Clerk, can we move to panel 2?
Michael Brown of Temple University Bicycle. He's a security officer. Darnell Clark, an employee at the Philadelphia International Airport. Arthella Harley, a commercial cleaner. And Gabriel Morgan, Vice President of SEIU 32BJ.
Mike, why don't you start? But I just want to, like many essential workers, Arthella and Darnell had to go to work. They were there throughout the earlier morning hearing, but, they had to go back to their essential work.
Of course. Do you have folks that you want to replace, put in their place to speak about the issue?
I think that Mike and I got it. We obviously have a lot of members who signed up for the public testimony at the end of the meeting who are watching this proceeding right now.
Okay. All right. So we'll have some folks at the end who will provide some public commentary. Okay. So if you were on that list in that order, if you could please state your name for the record and begin your testimony. So Gabriel, since you're up, why don't you go first?
I was going to let Mike go first, if that's okay.
Oh, is Mike on? Is Mike on?
Mike is on, yes.
Yes, I'm on.
Okay, Mike, I do apologize. I didn't see you on my screen here, but feel free to state your name for the record formally and proceed with your testimony.
That's okay. As being a security officer, most people don't usually see me.
Well, we want to see you. We want to see you. Be seen. Right. Be seen.
Right. My name is Mike Brown. Obviously, I work at Temple University. But I'm here today to speak not only as a security officer, but I'm here to also speak on the behalf of building cleaners, who, as you know, 32BJ has building cleaners that work in City Hall that actually clean your offices. I'm also speaking on the behalf of the Philadelphia airport workers, who most of us are underpaid, poverty, wage low people. This quarantine, when you get laid off from work because of quarantine, you're talking to officers and building cleaners who depend weekly on their paycheck. These are people like Councilwoman Brooks, who has grandchildren and children that depends on their wages, and these people work weekly. Their wages are weekly. So when we get laid off for 2 weeks and we work on a weekly basis, that hurt us. I mean, we're not able to pay our gas bills. That set us behind on our rent. So this bill is essential. So now I'm going to go off on the script that I'm supposed to go off of. I am an essential bike security officer at Temple University. I have worked on the front lines of this pandemic every day. Bike security officers, along with Philadelphia airport workers and building cleaners, are at Temple protecting doctors and patients. And these are doctors that enter the Temple University Hospital, leave the Temple University Hospital, and we also protect the community. But we also are considered heroes. We're considered first responders. Even though the news put pizza delivery people in front of us as heroes, security officers, to me, are literally first responders and heroes because we are the ones that call the police when trouble goes wrong. So we come to work looking at what we got to do to protect people. But we also come to work trying to figure out, how am I going to buy Pampers for my baby? How am I going to buy milk to feed my babies or Similac? Or how am I going to pay a bill? And then I go home and I find out that the daycare worker caught the COVID or possibility thinks she might have COVID. I come back to work. I tell my employer that I think I might have corona. And then they say, well, you know what? We got to lay you off for 2 weeks. Now, that's a mind-blowing experience because here I am protecting my client. I'm protecting the building. I'm protecting people that's walking down the street. Now I got to go home and I got to worry about how am I going to feed my children. And then the job, I work for a company, I'm not going to call their name, that I know is a billion-dollar corporation that can afford to pay. Now, I feel sorry for those who can't afford to pay some of their employees, like those under 10 employees or whatever. Well, I work for an employee that got over thousands of people across the United States of America. So they can afford to pay me 2 weeks if I got sick because I was on Scepter riding to work. So what I'm asking you guys, I'm not even asking you guys, I'm begging you all. I'm pleading with you all. These are people's lives that y'all see every day. These are people that take your trash out. Make sure your desk is clean. Make sure that your environment is COVID protected. That's making less than $12 an hour. I plead with you all. Pass this bill. Take some of the stress off of my officers, off the PHL workers and the cleaners. Just make life a little bit easier for them if they should be quarantined. Thank you for listening. Thank you, Councilwoman Brooks, for sponsoring this bill. I love you very much. For sure, I know you are in our hearts. Thank you. Thank you, Chairwoman.
Thank you. Thank you, Mr. Brown. And what we're going to do, I thank you for your testimony. I think that your words have really, rung a bell with the members of council. I am going forward, though, going to ask that everyone limit their testimony to 2 minutes. So we have an extensive list of folks to testify, over 40 people. So just to make sure that we get through and that we hear everyone, we're going to ask and set a timer. And we just ask that if folks would respect that. And so, but I think Mr. Brown set the tone. So we thank you for being here today. Thank you. If we could have our next speaker as called by the list. I think you said, Gabriel, that Darnell Clark and Arthelia Harley had to go to work. So.
Correct.
Okay. All right. So you're next up. If you want to go ahead and state your name for the record and begin with your testimony.
All right. My name is Gabe Morgan. I'm the Vice President of SA32BJ, which represents essential workers throughout Philadelphia, Pennsylvania, and the northeastern part of the United States. And I got this 2-minute window, so I'll be super brief. I couldn't say anything better than what Mike said. I just wish you could hear it from the hundreds of thousands of essential workers in Philadelphia who currently contract COVID at a 55% higher rate than the rest of everyone else. The folks who everyone says are heroes, but haven't gotten hazard pay, haven't gotten the protection they need at work, who are often working for multinational corporations at huge facilities like the Philadelphia Airport or Temple or all across the city of Philly, who don't need a pizza, don't need another poster saying they're a hero, and don't need an, in quotes, hero's day. What they need is to be able to provide for their families and to be safe. So what this bill does, and why we think it's so important, is it makes it so that if folks contract COVID or have to quarantine from COVID, because of the work they're doing that everyone says is so important, that then they actually have the paid time covered to make sure that they can. Saying to a worker at PHL who has been working throughout this entire pandemic that if they contract COVID, if they have somehow managed over the course of a year to accrue 1 week's vacation, that they should give up whatever vacation they have if they survive getting COVID at the end of it for working for their boss at PHL. Is not right and is not fair. And right now, workers don't have any protection at all. Last thing I'll say is this. I heard in the earlier session, Councilman I'll bring up Pittsburgh. The law we're asking you to pass has been in place in Pittsburgh since December. This is a much bigger city with a lot more essential workers. We're not asking Philadelphia to do anything that Pittsburgh, for example, isn't doing, but we are asking you to do something that will not happen if you guys do not act. These companies that will testify after me, they're testifying because they're not planning unless you make them and giving people COVID sick pay. The federal government's not going to act and the state is not going to act. We need you, essential workers, need the city to act now. Thank you.
Thank you. And you were right on time with your timer. So, but thank you so much for your testimony. We appreciate all of the work and advocacy that you're doing. We all care about workers. So I just want to make sure that message is out there that, we all, I think everyone who's testifying today is very much concerned about workers and supporting workers and how we best do that. So thank you so much, Gabriel, for your testimony. Next up, we have, I'm going to ask the clerk to call forward panel 3.
Elise Ford, Vice President of 1199C. Michelle Jones, District Council 33 member. Aaron Sanders, District Council 33 member. And Calvin Wongus, 1 PA member.
Okay, thank you, Madam Clerk. And is Ms. Ford available from 1199C, District Council 1199C?
Yes, I'm here, Councilwoman.
Very good. Please state your name for the record and begin your testimony.
Good morning, Council. My name is Elise Ford. I'd like to thank you for giving me the opportunity to testify today on the important bill number 210122. I'm the Vice President of District 1199C. We're an affiliate of the National Union of Hospital and Healthcare Employees, representing more than 10,000 individuals in major healthcare institutions around the Philadelphia region. I first want to thank the Public and Health Human Service Committee members who co-sponsored this extremely important bill, Council members Heenan, Gim, Thomas, and Bass. And most importantly, I'd like to give a special thank you to Councilwoman Brooks. I have been with District 1199C for 14 years. I'm proud to serve such a courageous group of members and fight for their right to have safe and healthy and productive environment. I come before you today to speak about a very important issue, which is the health, the safety, and the well-being of healthcare employees during a global pandemic. Our members support Councilwoman Brooks' bill, and we would ask that the rest of the committee would also support this bill. This bill was passed in December in 2020. It expired. And during that time, there was a peak in the COVID-19 cases in the city, which left some of our members with no choice but to go and work in conditions where they were experiencing symptoms. Thousands of healthcare employees are working daily on the front lines in the face of COVID-19. Many of our workers are in high-risk situations, caring for elderly patients and those in long-term home care. They continue to risk their lives and families' lives every day by continuing to work during this pandemic. Even though the cases are declining, we are still dealing with highly contagious variants that pose risk to the members as well as the people that they are caring for in the nursing homes. There is no time to relax on the public healthy measures, as the policies for the paid sick leave would drastically help stop the spread of the coronavirus. Through my research, I've learned that through American Journal of Public Health, they found that paid sick leave has stopped and reduced the amount of sick people that were actually going into work. Also, on the article through Health Affairs, they published that the emergency sick leave helped flatten the curve in the United States through the access of being able to make sure that workers do have paid sick leaves, which helped reduce the amount of cases per day from 1,300 workers to be able to go back into work without having the virus. Passing this bill is definitely a direct impact on the future of the nursing home industry, which is an industry of 80% workforce turnover. These workers have below average wages, and the protections that they need to be able to protect their families as well as themselves is very imperative that we make sure that our workers are protected.
Ms. Ford, can I ask you to wrap up? I'm sorry, we're at our 2-minute limit.
Sure.
So do you mind just wrapping up for me, please?
Like I stated before, I just urge that all the members of City Council just vote yes on this bill and to continue to protect the healthcare workers that have been protecting us. And I thank you for the opportunity.
We thank you. We thank you for being here today and for providing that testimony. It's very important. Thank you so much. Our next speaker, Michelle Jones, from District Council 33. Ms. Jones here? I realize we may have lost some people since the hearing was delayed slightly because of the hard stop. How about Aaron Sanders from District Council 33? Is Aaron Sanders available? From District Council 33? No, okay. And Calvin Wangus, 1 PA member. Okay. If anyone is listening who is a part of District Council 33 or 1 PA, if you want to invite them or someone else from the organization to come back on and testify, they are welcome to do so. We're going to move then to panel 4. Madam Clerk, if you could call up panel 4.
I want to have a comment.
Yes.
For the first couple of panels.
Oh, I do apologize. I see that you have requested a comment, Councilwoman Brooks.
Yes, thank you so much. I want to give special thanks to Mike Brown. And I wish we could have heard more of the workers like you. You did an excellent job of not only speaking for yourself, but your fellow workers. And I know you guys have been on this hearing since 9:30. I saw somebody on SEPTA trying to navigate wherever they were going. And I just want to thank you for taking the time to support this legislation. And I don't remember the names, but I want to say, like, this piece of legislation are for the sanitation works that I stopped on the side of the street on Chestnut Street last week. It gave me stories about what are they going through on the street, what it's like to have 3 people in a cab, someone gets sick, the whole bus has to go out, and then you have to figure out what are you going to do for your children the next week who also could have contracted COVID. And I also want to talk to the folks at the airport that I talked to last week as well that had similar stories about becoming sick, having to stay home, then possibly being exposed again and not having enough time to make sure that they're able to take care of their houses. I mean, paying their bills and getting through. So I just want to let you guys know that I heard it loud and clear to the folks at the airport, from the folks at Temple Hospital, to my neighbor who's also a security guard. We hear what you're saying, and that's why this piece of legislation is here in front of council to let you know that we care. I care about the folk who take care of my office. You know, I try to check on them when I'm in Center City, but thank you. And this is what this is about. So keep on pressing. We're listening, and, I'm sorry we weren't able to get through this morning, but I just want to make you know and let you know that, I hear you and I heard you. Thank you.
Councilwoman Brooks, I also want to invite, if you want to reach out to some of the folks or organizations that have been scheduled this morning because of the length of this morning, they couldn't hang on. If you want to have your staff reach out and see if they have some other folks who might want to testify or as service replacements, we certainly want to hear their voices.
We'll do. We'll try now.
Okay, very good. Thank you. Madam Clerk, if you could call forward panel 4.
Will Carter, Vice President of the Chamber of Commerce for Greater Philadelphia. Robert Zertiski, President of Parkway Corporation. Drake Nakasi, Vice President of the Asian American Chamber of Commerce of Greater Philadelphia. Blaine Stoddart, President and CEO of VFW Group. Joan Waters, CEO of COFCO. Melissa Bova, Pennsylvania Restaurant and Lodging Association. Ben Felicia, Pennsylvania Restaurant and Lodging Association, and Avram Hornick, Four Corners Management.
Okay, very good. And thank you for that work, Madam Clerk, excuse me. First up was Will Carter. I know that Will was logging on. I think he was on and was disconnected. Will, are you there?
Councilwoman, can you hear me?
I can hear you well.
All right. Good morning, Chairwoman Bass and the members of the Committee on Public Health and Human Services. I'm William Carter, Vice President of Local Government Affairs for the Chamber of Commerce for Greater Philadelphia. We're testifying to you today to appeal for your consideration of the reality of the city's current economic situation and to express how Bill 210122 as written, although well-intentioned, does not balance the comprehensive emergency affecting both workers and businesses that COVID-19 is. It is important for us to be clear. Keeping people safe is the first priority. There is no lack of recognition about the unprecedented nature of this emergency and the people it has affected. This, however, is about a recognition that COVID-19 is both a health and economic emergency. At a time when Philadelphia is already struggling to reopen businesses and have workers return to the city, generating tax revenue for the city and spending money locally, this legislation would only harm the city's ability to rebound and grow. Our opposition to the bill as written is based on the simple premise that while prioritizing safety, Philadelphia and Philadelphia's residents need more jobs, and this proposal would harm already struggling businesses and limit much-needed job creation. Further, the Biden administration has recognized this and is currently moving toward an approval of a nationwide paid sick leave expansion that includes tax credits to reimburse businesses for the expanded benefit. This balanced approach is simply good policy and appropriately considerate of the health and economic emergency we've all been experiencing. Moving forward on a one-sided bill, conversely, reinforces the perception that Philadelphia does not value its business community to the extent that many other cities do, and the reality that some of our officials, despite clear evidence to the contrary, refuse to see the reality that businesses are also suffering. The economic conditions affecting all businesses following the pandemic and resulting recession is well documented. Monthly unemployment figures in Philadelphia show 64,822 people unemployed. The labor force has shrunk by 45,000 people since February of 2020. As the city is looking to recover and reopen business safely, we should be working together to make it easier for employees and jobs to come back to the city. Thankfully, as mentioned, the federal government is moving towards this approval nationwide paid sick leave expansion, one that includes tax credits once again to reimburse businesses for the expanded benefit. The stimulus is scheduled to be finalized before March 15th. This is the balanced approach that is required right now. Further, the city has already found a prudent policy to see what the federal government is going to do in terms of its own budget. That's why the budget process was moved back to begin April 15th. For the sake of fairness and parity alone, it would make sense that the same consideration be given to private businesses' budgets regarding the emergency paid sick leave, and that this legislation be held in committee pending what the federal government is going to do in this regard. In closing, this bill as written appears to be tone deaf to what's really going on here. We can't ignore that it will dramatically increase the amount of paid time off businesses would have to provide beyond benefits they already pay for, and the sponsor knows this. Moreover, our representatives on the federal level, recognizing the health and economic emergency that COVID-19 is offering the balanced plan that helps both businesses and workers, and this approach simply recognizes the reality of this global emergency.
Thank you for your testimony. Thank you so much for being here today and providing your perspective. We look forward to hearing from the other speakers as well. Thank you so much, Mr. Carter.
Can I just add, Chairwoman, can I just add that we had a number of people.
You're slightly over time already.
I know. I just want to let you know we had a number of people that were prepared to testify, just like the advocates.
Sure.
Who couldn't stay on the call. All right.
Certainly. Well, and I want to welcome the same opportunity to you as well. If you want to dial up some folks who would like to offer testimony, they are more than welcome to attend.
Thank you.
Councilmember Bass, Michelle Jones was able to hop back on real quick, one of the workers that we had lined up.
Excellent. Okay, why don't we have Ms. Jones? One moment. Okay, she was in panel 3. We're going to cut to Ms. Jones, who is in between her work and who was able to come back and join us. Ms. Jones, are you there?
Can you hear me?
I can hear you now. Very good. Please state your name for the record and begin your testimony.
Michelle Jones. I work for sanitation. I had COVID last year of July and August. I'm still having the after effects of COVID. It's been hard for me. I'm having heart problems now, and I just seen my cardiologist this morning. I have lung issues. I'm not getting paid. I'm out on my own time. I have 2 diseases that's on my lungs, even though I did have underlying conditions. But some of the COVID brought some of this other stuff on. And I have not been feeling good. I have not been feeling well. My cardiologist wants me to go out on partial disability. I don't want to do it because I want to try to come back to work, but it's going to be very hard for me. And I work in sanitation. It's so overwhelming.
Okay.
I'm by myself. I have friends to talk to, but it's a lot.
Yeah.
A lot.
Well, I can certainly imagine the challenges. Although we wish you the best. Health is just so very important, and so we thank you for coming back and for offering your perspective and giving us sort of like the real life perspective on what happens after you've been diagnosed with COVID and what some of the things that can happen and how it can really wreck your health. So we do appreciate you taking the time to come back and to talk to us today.
Thank you. And I do see my infectious disease doctor tomorrow. Also.
We wish you the very best. We certainly wish you the very best.
Thank you.
You're very welcome. Thank you for being here.
Thank you. Have a good day.
All right. You do the same.
Bye-bye.
Take care now. And if we could have our next speaker, which was Robert Zaritsky from the Parkway Corporation.
Hi.
Hello.
Thank you. How are you doing? Thanks for letting me speak. I'm here representing. Am I on there?
No, please. Yes, you're on. Please state your name for the record and then begin.
Robert Zaritsky, and I'm representing the Philadelphia Parking Association and our 2,000 wonderful employees. I am, here to talk about this bill, and I realize that council's heart is in the right place when considering this type of a bill. I do want to mention that I think it's important for the city also to have bills that are beneficial to employees, but also start to have bills that are beneficial to encourage businesses to open here as well. Cities and regions compete for business and employees. And a city that only considers new taxation, regulations, and added new hurdles risk adding to its reputation as an unfriendly place to work. I can't speak for all businesses today. I'm only addressing the challenges of the parking industry, which is basically on life support. Our business is down 70%. Business conditions are the worst that we have seen in our 91 years of doing business in Philadelphia. Before the pandemic, our industry was subjected to 11 tax and fee increases over the last decade. With all of those added burdens placed on us, not one bill has been passed to help our industry create jobs. If we want to keep businesses in Philadelphia and attract new ones, we need to think of ways that might lower taxes and reduce the complexity of doing business here. And again, I appreciate where many council members' hearts are on proposing a bill such as this. And know while you may be helping employees, you are also sending a message loud and clear to the business environment, which could be bad for employees also. So let's make Philadelphia known as a city that attracts great businesses and great jobs, is a magnet for great citizens to live and play here, and not just added city regulations and taxes. Thank you.
Thank you for your testimony, and I appreciate your perspective. I think that your statement in terms of how do we find ways to support businesses is something that we as a council need to look further at, because certainly, we know that it's an environment right now where businesses have been adversely affected and workers have been adversely affected. How do we, help those who need help and those who need the most help? So I appreciate your perspective, because we can't put people to work if we don't have any businesses. So it's important to us to have businesses and that we find ways to support them during a pandemic as well, because we need places to be able to go back to. Okay, once the pandemic is over, we need businesses, we need folks to be able to go to work, and we need to find ways to be supportive. So thank you so much for your testimony, Mr. Zawitsky. Next up, we have Drake Nakashi, Vice President of the Asian American Chamber of Commerce.
Madam Councilwoman Drake, I'm Narasimha Shinoy, President of the Asian American Chamber of Commerce. Drake has some technical issues. He just sent me an email, so I'll read the testimony he was going to do.
Okay, very good.
Thank you. Our members in Philadelphia all hope to grow and prosper, but when we see slowdown in the employment base in large companies, either because of the pandemic or increased government regulations, it does eventually affect all our businesses with less foot traffic and patronage. While this legislation was a focus in helping families during the pandemic, the economy is just starting to open up because of the number of vaccines and therapeutics. In addition, Congress appears to be passing legislation that speaks to the pandemic by providing direct relief similar to what is being attempted in this legislation. Please understand that if Philadelphia places greater restrictions than the rest of the state or nationally, this puts Philadelphia in a non-competitive situation. Well-intended legislation such as this legislation may be Well-intended legislation such as this legislation may be the final straw that encourages more part-time employment and relocation to other regions or adjoining counties. It is a lose-lose situation. We continue to hear from our members that they would love to do more business and expand into Philadelphia, but the business climate is not friendly to small businesses, but all business in general. We all hope that Philadelphia does well, because without the vibrant Philadelphia, the region will suffer. But the city council efforts would be better spent on helping the businesses by making the streets safer, improving the marketing messages to showcase the businesses coming back, etc. 2020 was a year that our members will long remember. First with the pandemic, then the economy slowed down, social unrest, where many of our businesses were looted and burned. We saw a lack of police response to the chaos, and now our businesses are opening up. There appears to be a heavy-handed government that sets arbitrary rules and guidances that makes having a small business very difficult. The Asian American Chamber of Commerce is asking the legislation be held in committee until the federal government takes action. Thank you for giving us the opportunity to make our statement. Thank you, ma'am.
Thank you, Mr. Shinoy. Thank you for your testimony today. We greatly appreciate that. And we thank you for your perspective and understand your thoughts on this matter. We're going to go to the next speaker, which is Blaine Stoddard, the president and CEO of BFW Group. Blaine, are you still with us? Blaine Stoddard.
Councilman, I believe he had to drop off.
Okay. All right. So, Will, if you want to check and see if he's able to come back and join us, we'll now move to Joan Waters, who's the CEO of COFCO. Is Joan with us?
Councilwoman, likewise, I've been informed that she had to drop off for business.
Okay. How about Melissa Bova? Is Melissa here from the Pennsylvania?
Sorry, Mr. Call. Please leave your name, phone number, and a brief message, and I will get back to you shortly. Bye.
Melissa Bova of the Pennsylvania Restaurant and Lodging Association. Is Melissa on? Nope. Okay. All right. Ben Felicia, Pennsylvania Restaurant and Lodging Association. Ben, are you with us? All right. How about Avram Hornick?
Yes, I'm here.
Avram Hornick from Four Corners Management.
Yes, Councilwoman, I'm here.
Very good. Please state your name for the record and begin your testimony.
My name is Avram Hornick. I own Four Corners Management, FCM Hospitality. Give me a second here, sorry.
Sure, take your time.
I would like to testify today about the proposed bill. I would like to say that as many of the other people have said, that I completely agree with the intent of the bill. Certainly the working people of Philadelphia has suffered greatly during this pandemic, especially the essential workers. Mainly I'm in the restaurant business and hospitality business, and we've had to be working this entire time. But the question is, does the bill as drafted accomplish its goals? Does it work to achieve the protection of Philadelphia workers in a fair way? And the question is, who should pay for it? Who should be paying for these additional sick leave benefits? And I think the bill as drafted unfairly burdens labor-intensive industries that require a lot of employees to work on them versus employees that don't require as many workers. And our goal in Philadelphia is to encourage as many domestic working hours as possible, to create as many jobs as possible. But by saying it's only for employees over 50 people, it's really saying that the businesses that happen to be labor intensive but not necessarily as profitable have to cover the expenses. Well, it would be more fair to make the burden be on businesses' profitability rather than their overall labor forces. So it really unfairly hurts mid-sized businesses, and it's not equitable because it doesn't have a cap on the amount of money. So it's saying that if someone's earning $200,000 a year or earning $30,000 a year, they're still getting 2 weeks worth of pay, which isn't necessarily fair to lower income or working people. But this is a rare opportunity where we can get benefits to Philadelphia workers without having to have Philadelphia businesses pay for them. The federal government right now has so many programs available for businesses: the PPP loans, Employee Retention Tax Credit, Family Leave Act, which allow reimbursement for paid family leave. Wouldn't it make more sense to have our law parallel the federal requirements? So saying that Philadelphia businesses are required to provide paid family leave should they have the option of getting paid back from the federal government and matching the federal government reimbursement rates. So therefore, the workers will get the benefit. At the same time, the employers will not have to pay for the benefit. This is really a rare opportunity for a win-win situation for Philadelphia businesses and Philadelphia workers. And City Council could take an active role in encouraging accountants and other financial advisors to help businesses apply for these government programs. They're very complex. This is an opportunity to be able to do that, which would benefit everyone. So I would just say my testimony would be to recommend that you take another look at the bill itself and try to match its requirements to the federal rules, and therefore saving mid-sized businesses in Philadelphia the money while still protecting workers. Thank you.
Thank you for your testimony. I think that your idea is one that certainly merits exploration, and I'd be happy to speak with the bill sponsor so that maybe we can have some additional conversation about trying to find a way that we can, be helpful to our local workforce, be helpful to workers, and maybe have some support from the federal government that would help local businesses who are, going to be providing that support in terms of reimbursement for that level of support. So that's something that, I'd be certainly happy to have a conversation with Councilwoman Brooks and, have further additional conversation. So thank you. Yes, ma'am.
So currently, based on the tax credits that the last speaker just referenced, they already exist, and they have existed since March of last year. So that's not correct information. The tax credits are available to small businesses and mid-sized businesses. They already exist.
That was my point. That the tax credits do exist, but the Philadelphia rules should parallel those tax credits. So the same eligibility requirements that the federal government have that are eligible for reimbursement are the same requirements that the Philadelphia bill should have. So that we make sure that the Philadelphia businesses can be reimbursed by the federal government for paying their employees for these well-deserved family leave and sick leave act.
Right, and I think that what we want to do, and Councilwoman Brooks, we'll talk offline if that's okay with you. But we'll have a conversation, because I think what we're trying to, what is suggested here is that if there are benefits and opportunities that are still out there, then let's explore them all. Let's see what else is out there, and if there's an opportunity to do something, then let's try to do that. Let's try to be as helpful as we can. And get workers the protection that they need. And at the same time, if the federal government can pick up the tab, then I think they're certainly in a better position to do so than a lot of local small businesses. So let's have that conversation. Let's talk about it. Councilman Derek Green, or 1 second. I just want to make sure we're done with this panel, because Councilwoman Brooks had a question or a comment after this panel, and then Councilman Green. But I did want to go over panel 4 and just make sure that any of the folks who were here, if they have since arrived, and that would be Blaine Stoddard, Joan Waters, or Melissa Bova, or Ben Felicia, if any of them have arrived. And if not, Councilwoman Brooks, please begin your comment.
I'm holding I don't have a comment at this time.
Okay, all right. Councilman Green?
Thank you.
A question?
Thank you, Madam Chair. I wanted to follow up on the comments that Mr. Hornick made, as well as other members of the panel. My understanding, first thing, are there other jurisdictions that have tried to do these type of protections at the local level and try to mirror what's happening at the federal level?
Councilmember Green, was that for me or was it for Will Carter?
That was for the panel, for people on the panel. I'm just curious if there's been other initiatives in other jurisdictions where you've tried this type of partnership where you've had local legislation to help employers with these type of benefits and make that connected or parallel to what's in the federal guidelines.
Councilman, it's my understanding that a bill mirrored after the one Councilwoman Brooks was introduced in Pittsburgh and passed, but it doesn't follow the federal guidelines as we're asking. It doesn't allow the federal government to pay for the benefit as they're offering, and which is, once again, a balanced approach that makes sense. It would be bad policy not to even consider that if the money is on the table.
Right. And also, I just have a point of information. My understanding that the tax credits expired on March 31st, and that the current plan under the American Rescue Plan that's in front of the Senate now would include that concept regarding tax credits.
Absolutely. Right now, although the sponsor indicated that her amendment doesn't make it retroactive, it doesn't need to be retroactive at this point because, as you mentioned, the credits are still there until March 31st. The Biden administration is just taking it from March 31st forward and just keeping it going, and allows businesses who much really need it to take advantage of this reimbursement.
So so make sure I understand. So unless the American Rescue Plan passes, businesses would not be able to receive tax credits to pay for this benefit. And if they do, we're not sure how long that benefit will be available. I've heard September 30th, or it could be longer, it could be shorter. We don't know what those benefits will be until that legislation becomes, assuming hopefully what will become law, because we definitely need those dollars here in the city.
Right.
If it becomes law.
Yeah, Councilman, that is correct. It's our understanding that from my federal counterpart, that it is expected to be passed finally by March 15th. The House has already passed it. It is in the legislation. It allows for the tax credits, and it's expected to be passed March 15th.
Right. Councilman, one more point, that there is another tax credit, the employee retention tax credit, which is available all the way through June 30th, which provides a 70% reimbursement, including a reimbursement for paid sick leave for employees. So there's this program. It's a great program, especially for people in the restaurant business, because it requires a drop in business. That the city could really do a lot to encourage people to apply for this program, because it's really a lot of money that would come into the Philadelphia economy when all of us could really use it.
Madam Chair, I have a question for Mr. Laser.
Certainly. Mr. Laser, are you still with us? I see you are.
Yep.
Okay.
So, Mr. Laser, even while we had the existing legislation that Councilman Brooks had introduced and passed, which expired in December, what steps did the city take to help employers participate in some of these tax credit programs? Because one of the issues that various people raised is that there are challenges regarding the small businesses and their ability to stay open. But if we had the legislation that was introduced and passed by council under Councilmember Brooks' leadership, and we had these tax credits that were available that don't expire to March 31st, what steps did we take as a city, especially for so many businesses, especially restaurants in particular? What steps did we take as a city to let these companies know that we want to make sure that we provide emergency paid leave for their employees due to the pandemic and our local legislation, but there's some tax credits that you can apply for in order to reduce the financial burden?
Yeah, I could circle back. I know Commerce and PIDC have been engaged in working with businesses to take advantage of the different programs, so I can circle back with an answer on that.
Okay, will you be able to circle back during the time of this hearing?
I will try.
Okay. I mean, I think that's a real important concept that, we took steps to try to help workers to make sure they had leave and paid for leave during this pandemic. But you've also had a number of businesses that have been really decimated. And if there were federal tax credits, there are federal tax credits that are available to the end of March. And when the legislation was active in December of last year, they could have been applying for that type of tax credit to help these small businesses during this time period. And you could have had the benefit of not only having their employees received sick leave through the end of last year based on COVID to care for them or their children or others who may have been impacted by the pandemic, but also as business owners could have had an opportunity for those tax credits.
No, I'll disagree. I'll circle back.
Okay, Councilman Green, are you, is your question?
Sorry, Madam Chair, I'm finished. Thank you.
Okay, very good. Thank you. I do want to reflect that Councilmember Bobby Heenan is present, so I do want the record to reflect that. Councilmember Brooks had a question, and then I think Mr. Hornick had a point of clarification. Okay. Councilmember Brooks?
Yes, thank you so much, Madam Chair.
Yes.
I have a question for Gabriel Morgan. Can you talk about what it's been like to work with employers to give the voluntary paid sick leave? You're on mute.
Apologies.
And I can add a part 2 to that. Okay. Also, can you tell me about the federal tax and if or how it impacted the legislation similar to this in Pittsburgh?
Yeah, let me start with that. I would just remind council that some of the organizations that are bringing up tax credits now and waiting for the federal stimulus package are in Washington, D.C., actively opposing the federal stimulus package even as we speak, such as the Chamber of Commerce. 2, when tax breaks have come to big businesses, like the $1 trillion tax cut that happened in the Trump years, generally speaking, the bailout money that's come during the various COVID packages to big employers. Same entities have done everything they can to make sure that they're not tied to working conditions, to wages, to things like paid sick. So I got to say, before even talking about Pittsburgh, the idea that we'd be sitting here with hundreds of thousands of essential workers risking their lives on behalf of employers with 50 or more employees, on behalf of the city, on behalf of everybody. And we've let COVID sick relief expire. And now we're having a conversation about what we can do to make the same businesses who haven't seen fit to provide such a thing for their employees now or before the pandemic. To me, it feels, just channeling my members, pretty outrageous. Also, I think as council knows, at no point in time when business comes to you guys and says we want a tax break, do they ever want you guys to tack strings for what will happen to workers, their wages, their benefits, or their health care, because they tell you that's also bad for business. So as it relates to Pittsburgh, no, Pittsburgh enacted this legislation in December, not knowing whether or not Joe Biden would be the president, whether there would be another set of stimulus relief, whether the federal tax credit program would extend, or et cetera. They did it because they recognized that essential workers like those in Philly are deeply, deeply in need, and that they're contracting COVID at a higher rate. And most of them were working in poverty before, and they continue to work in poverty now. Since then, we haven't seen in Pittsburgh some dramatic reaction to the economy or pull out of business beyond the pandemic that we're all dealing with. And I would just remind folks that this is really limited to people who are working as essential workers who have to quarantine because of their job. And it excludes people who employ 50 or less employees, so almost all small businesses. And that people right now have nothing. So, again, for our perspective,
Councilwoman,
defense
may I
Councilman
respond?
Brooks, tax policy is fascinating, but if I'm Mike Brown or many different workers who are out here right now risking COVID every day, it's too much to talk about if they need paid sick days during a quarantine. How do we tie that to tax breaks for businesses that are actively opposing stimulus right now?
Councilwoman, may I
thank you for your comment. Chair recognizes William Carter.
Councilwoman, I feel compelled to respond because he mentioned that the chamber is opposing this legislation on the federal level. That is not the case at all. I don't know where that information came from, but we are not opposing that. We are supporting this legislation on the federal level, and we've sent that out to all of the council.
You guys are supporting the Republican caucus in the Senate around their opposition to this package?
I'm just trying to respond. I allowed you to speak. Trying to respond. Also, you mentioned Pittsburgh passed it before they knew what was going to happen on the federal level. We're in a better position now. We have the benefit of knowing what's happening on the federal level. There's a new administration there who's committed to making this happen. It's coming down March 15th. Why would we put anybody, businesses or workers, in a worse position when we know this is happening? And
workers are in the position because workers don't have a choice. They're there now. They're in the position.
Listen, I'm going to tell you this. Several of the people who I had to testify on this call had to drop off because they had to go back to work. There are no less workers because they work for themselves. They're working people who happen to work for themselves. So you can't discount people that work and own businesses. Some people work for others. Some people work for themselves. And that's our problem with this whole piece of legislation. It doesn't recognize that.
Okay. I don't discount any workers or people work for themselves. Right now, there are hundreds of thousands of people working essentially to keep society going who do not have paid sick time if they contract COVID, if they are hospitalized, if they must quarantine to protect the rest of us.
We recognize that in my testimony and all the testimony. We're saying if there's an opportunity to help everybody, it would be bad policy not to do so.
Okay, very good. Very good. Thank you very much, Mr. Carter, Mr. Morgan. Thank you very much, both of you, for your commentary. We're going to move to the next panel now. And actually, I'm going to ask, is there anyone from any of the previous four panels who was called to testify, who was listed on the list, and who did not get an opportunity to speak? And while we're waiting for them to present themselves, I do want to recognize Mr. Michael Brown, who I see has raised his hand. Mr. Brown?
Yes, I would like to ask this gentleman, do he think the restaurant owners are more important than essential workers that are actually out protecting citizens and students and even his people.
Am I the gentleman you're referring to?
Yes.
Well, I appreciate that. Thank you very much. I don't think anybody's more important than anyone. I think we're all out here struggling, trying to make it happen. This was unprecedented situation. I worked in city council for 16 years. Honestly, I wrote the original paid sick leave legislation before it got to Councilman Green. I see in the year and a half, which has been the craziest year ever, I've seen everything. I have matured to the point where you see more grays in my head than anybody's ever seen before on this young looking face. So at the end of the day, I just recognize that we also have struggling businesses out here. I tell people all the time, I travel once a week just because I have to get out of the house. I'm talking about driving my own car just to clear my head. And I purposely go to commercial quarters throughout the city and see how many businesses are boarded up and see how many businesses have closed down and left. And so it's just a non-recognition that this wasn't only a health emergency, but an economic emergency. It's been well documented. It's all over the papers. It's everywhere. And this legislation just seems to be tone deaf to that reality. Yes, it's important to help workers. Of course, I've been a worker. I'm still a worker. But it's also, I want to have a place to work too. And if there's an opportunity from Joe Biden and Kamala Harris to say, hey, we're going to provide this because we recognize this comprehensively, then why would we would be derelict in our duty not to consider that first and roll in that way because we just want to push something because, we think it needs to happen right now. That's just not good policy. And that's not, in my opinion, and several others, that's not the best way for the city to grow jobs and bring businesses back to the city right now, which is sorely, sorely needed.
But for
Okay.
For me, it sounds like what you're saying that it's more important for the owners than it is for the actual people that's under poverty, that's working, that's being quarantined and can't afford to be sick.
Mr. Brown, I thank you for your comments. We unfortunately don't have enough time to have a continuous dialogue because we have a lot of people in public testimony. But I think that, we hear you loud and clear. We hear you loud and clear. Mr. Hornick, I'm going to ask that you hold your comments until we get to some of the folks who haven't had a chance to actually testify yet. And so we're going to move through to that list now. Madam Clerk, can we have you call the next four people that are scheduled under public comment? And anyone who does not get a chance to speak now before the end of the hearing, if you have further comments, we don't want to have the back and forth, but if you want to make an additional comment, we'll give you another 30 seconds to be able to do that. So thank you so much. Madam Clerk?
And Madam Chair, council support will need some time, just a short break to start calling in people.
Very good. Okay. So we will take Madam Clerk, is that a 5-minute break, 10-minute break? What do we need?
Modesto, is it just like 1 to 2 minutes?
Just need probably about 2 to 3 minutes to get situated.
Okay, why don't we give it 5 minutes just to be sure? It's 3:55. Why don't we reconvene at 4 and we can have our callers lined up at that point? That would be fantastic. So we're going to be in recess for 5 minutes while the technical team dials up the public comment so that we can hear from them as well. Thank you. we want to go ahead and get started again. And first up, we're going to have from our previous panel, Blaine Stoddard, who has arrived. Mr. Stoddard?
Chair. Madam Chair, can you hear me?
I can hear you well. Please state your name for the record and proceed with your testimony. We are limiting testimony to 2 minutes today based on the number of folks who have signed up to testify. So it's a lot of folks, so we ask that you complete your testimony in 2 minutes.
My name is Blaine Stoddard, Stoddart. I run a company called BFW Group. That's Boy Frank Water. We're at the Navy Yard. And I have been involved in community economic development and affordable housing now for 28 years. And I know, Madam Chair, that you may not believe it, but it's actually been 28 years. I want to talk about the bill in question and talk about the paid leave bill. I am not sure why this bill is still on the table in light of the $1.9 trillion COVID relief bill that's being debated in Washington, and at some point, all or most of that money will be coming out, and some of it will be coming to the cities, and some of it will be going to people, directly to people and to businesses to address some of these issues. But right now, Madam Chair, I have submitted written testimony. If you do not have my written testimony, your staff is in possession of my written testimony. There's just one or two things that I want to say. Number one is that businesses are hurting. 53% of Black businesses allegedly are out of business. 30% of restaurants are out of business. Retail, hotel, the convention center, travel, the airport. A lot of these businesses are in bankruptcy if it were not for payroll protection. And so as we think about the bill, as we think about the edits that have been made to the bill, saying it's for people over 50 employees, you have to think about how that plays into Philadelphia welcoming businesses. Businesses are leaving the city, and we do not need another unfunded mandate to make more businesses leave the city. We need jobs. We need economic opportunity. We need economic inclusion. Those are the things that I feel that City Council should be working on, not on a bill to punish businesses after we've gone through COVID at least 3 times already this year. And we don't know if COVID is going to come back. Right now, it's down 30%. But I beg to this committee and all the people that are on here to vote against this bill. Please vote your conscience, because we cannot come up with another bill to hurt small businesses, because we depend on the large businesses to survive too.
Blaine, thank you for your testimony and thank you for returning. We appreciate your commentary. Thank you very much. We're now going to go. Absolutely. We're now going to go into public comment, and I believe April Kalk was first. April?
I'm here. My name is April. I work at the PHL airport here in Philadelphia. I work for Prospect, and my department is wheelchairs. I work very closely with the people who are flying in and out of the airport. Most of them are sick leave. That also includes, I do aisle chairs. That means I'm in direct contact. There is no social distancing. There's no social distancing going back and forth through TSA. We have to pull our masks down at least 20 to 30 times a day to show our face along with our ID to TSA so they can do their job. I'm 100. We really need this to pass, because we don't get sick time at all with Prospect. We only earn 1 hour a month that accumulates to 8 hours for us to call out to be able to use our PTO for sick time. So I have to work at least 8 months. No, I'm sorry, that's 1 hour every 2 weeks. So I have to work 4 months to accumulate 1 day to call out to use a time, my time that I earned to get paid for that day that I'm off. So I am desperately urging for you to pass this so we can get in case we do catch COVID, like someone already talked about, they're taking our vacation times or our PTOs. If we call out, they're using that. So if I work all year long and I have one vacation week, I can't go on vacation with pay because it's gone due to COVID. Thank you for allowing me to speak.
Thank you for your testimony, and thank you for making us aware of the amount of time that you're required to work at your particular job to be able to earn some paid sick time, which is just not acceptable. I'm very hopeful that we will get some help on these particular matters to the Biden administration. So, but I thank you for bringing that forward, bringing that information forward. Arthur Hardy is the next up to testify. Is Arthur Hardy available and on the call? Arthur Hardy. Okay, next we're going to go to Charity McNatt.
Yes, speaking. My name is Charity McNatt. I'm a essential worker for the Federal Reserve Bank in Philadelphia, Pennsylvania, and I support the bill number 210122, COVID paid sick.
Very good. Did you have additional testimony?
No, not at all.
Ms. McNatt. Okay. Well, listen, we thank you for stating your preference on the record, and will be taken into consideration by City Council. So thank you so much for being here today. We really appreciate that. Next up, we have to speak Damon Harris. Is Damon Harris here? Okay. Next, we have Darnell Green. Is Darnell Green here? Or Deborah West? Deborah West. How about Eric Stevens?
Yes, I'm here.
Hi, Eric. How are you today?
Good. I'm doing fine. How are you?
I'm very well. Please state your name for the record and begin with your testimony.
My name is Eric Stevens. I work for the Philadelphia Water Department as an electronic technician. Many times my job involves entering into the manhole, and what our concern was the I read about on the CDC website about aerosolized fecal matter, and our supervisors, they provided us with an N95 respirator mask. And during my research, I found that was not adequate protection for entering to the manhole with aerosolized fecal matter. And so they kind of forced our hands and kind of, gave us an option of either going down or getting written up. We had a little bit of time. We kind of finagled things, and I was able to purchase my own. I spent about $100 and purchased my own PPE. That's pretty much where I stand at right now. But Ernest Garrett, he invited me to the meeting to make a statement about it. But they have. I'm sorry. What were you saying? I'm sorry.
No, I just said excellent. Excellent. I'm glad you're here.
Oh yeah. They have yet to provide the proper PPE according to the CDC. We went to the safety office and everything, and they were aware about aerosolized fecal matter and the inadequate protection that they were providing, but still nothing was done about it. So me and a couple of my coworkers, we just went on our own and bought our own respirators and the mask. So, So that was just my main concern, for them to possibly, maybe in the future, if this thing carries on, maybe to provide us with the P99 mask as opposed to the N95 protection.
Well, thank you for your testimony, and I would agree. I do believe that you shouldn't have to buy your own protective gear, when you're doing a job that is puts you particularly in high risk, like that material should be provided to you. So, but thank you for being here and for your testimony today. Next up, we have Jessica Jackson. Is Jessica here?
Hello, how are you?
Hi,
Yes.
I'm great. How are you today?
Good, and you? My name is Jessica Jackson. I'm a security officer at the Municipal Service Building. I do stand in support of 210122 for the COVID sick pay. In my testimony, I would like to add that we are essential workers due to we are security officers. We don't get the recognition of being an essential worker because I have no idea why don't we. But we don't practice social distance. They don't take temperatures. They said that our building is supposed to be closed to the public, but actually we're not closed to the public. We get people come in all times a day, from 7:30 up until we close to 5:30. Our security officers are not protected. Some of us had to provide our own masks. Some of us had to provide our own hand sanitizer and wipes just for our posts. The people come up to us. They told us that we're supposed to practice social distance 6 feet, but we have to interact with the public with their cell phones to see if they have an appointment for anywhere into the building. Where in the beginning, they was telling us that they're supposed to provide someone in the main lobby that's supposed to be doing those things, but security is actually doing the work of the employees actually that's supposed to be doing the work. So I just think that they need to pass this because we're really struggling down here. Thank you.
Well, I thank you for your testimony. I thank you so much for your testimony and for enlightening us to that. I had no idea. I do want to see if Mr. Laser is available, if he could come back on and speak to that about the entrance to the building and providing the proper protective equipment to workers and to ensure that folks are safe coming in and who are working there. And that the proper protocols are followed. So is Mr. Laser still on the line? Is Rich Laser still here from the administration? No? Okay, Madam Clerk, if you could see if we could get Mr. Laser back to answer that question, I'd appreciate that. In the meantime, we're going to call forward Keisha Hayes and then Kim Cooper and Laquita Robinson. In that order. Is Ms. Hayes available? Keisha Hayes? No? Okay. How about Kim Cooper? Kim, are you here? Okay. How about Laquita Robinson?
Madam Chair.
Yes, ma'am.
Rich Laser was just on, but I think he dropped off again. I'm going to call him back again.
Okay, very good. In the meantime, we'll continue to call through our public comment. Folks here, Marilyn Robinson, Michelle Dennis, and Mike Johnson. Is Marilyn Robinson on the line? How about Michelin Dennis? Michelin Dennis. Okay. Mike Johnson. Naima Parker.
Yes, I'm here.
Hello, Ms. Parker. Please state your name for the record and begin your testimony.
Hi, my name is Naima Parker. I'm a security officer at Temple University campus. I work for LI Universal. And I stand in support of bill number 210122, COVID pay sick. And my testimony is I've been out of work since January the 20th, 2020, due to COVID-19. And I feel like our site is not protected. Like, I was working in a building where they were doing COVID testing, but it was only for Temple University staff and students. And by them coming in and out of the building, I feel as though that's where I caught the COVID-19 from. And we don't have any type of sanitizers, Lysol, or anything at our post. And I just feel like we need to pass this bill for paid sick leave. Thank you.
Okay. Thank you very much. Thank you for being here and for your testimony. Raymond Thompson. Is Raymond Thompson here? Raymond Thompson. How about Richard Thorpe? Richard Thorpe. How about Robert McMillan? Is Robert McMillan on the line? Or Sean Holloway? Sean Holloway? All right. Stacy Price?
I'm here.
Hi, Stacy. Please state your name for the record and begin your testimony.
Okay. Hi, my name is Stacy Price, and I work as a cleaner at 399 Market. I stand in support of bill number 210122. I contracted COVID earlier this year, and fighting COVID and not getting paid, it was scary and stressful. Being isolated, alone, and sick, and worrying about bills that need to be paid, I just hope it's something that no one else has to go through. This bill will take that worry away from so many of others. I stand in support of the bill 210122. Thank you.
Thank you. Thank you for being here. We appreciate your commentary. Tammy Richburg, are you here? Tammy Richburg. Okay, how about Tyrone Patterson?
I'm here.
Okay,
Hello?
please state your name for the record. Hi, Tyrone Patterson. Please state your name for the record and begin your testimony.
All right, my name is Tyrone Patterson. I work at 3 Logan. I'm an allied employee worker too, security guard. Well, my concern with this is why we need to pass this bill is because what happens is, and 3 people at my job caught COVID. And what happens is nobody want to say they got it. They don't want to say they're around anybody because they're scared they're going to lose pay. When they lose pay, then they lose everything. So this is my concern. We need to help because the big businesses are helping. The law companies give their people off and let them work at home. We can't work at home. So that's hard for us. So we come in, we stand next to people that's been next to people that have COVID, but nobody's going to say it because what happens, then the whole building has to go out because we got to quarantine for 14 days. Thank you for allowing me to give my piece.
Well, we thank you for being here and thank you for giving your testimony today. It's very important. Miss Veronica Smith, is Veronica Smith here? And how about Vincent Jones? Is Vincent Jones on the line? Hi, Vincent, yes, please state your name for the record and feel free to begin with your testimony.
Okay, my name is Vincent F. Jones. I'm a housekeeper at the 1101 Market Street, the newly remodeled Jefferson Center. I've been a long-standing member of 32BJ, and we've been deemed essential, I guess, at the beginning of this pandemic because the actual health department is housed in our building. And in the beginning, I was starting to wonder whether essential meant expendable, but I hope that's not the case. But I would also like to urge and stand in support of this bill, and I urge you guys to pass it, you beautiful ladies and gentlemen of City Council. And because summarily, I mean, we have several people that I work with had already tested positive, and thank God they came back. But, you know, as we perform this High Wire Act for the city of Philadelphia, we would love to have the proverbial safety net that you guys could provide us. So if that could be the case, I urge you and I thank you in advance. Thank you.
Well, thank you. We thank you for your testimony and for being here today. And for being providing your commentary. I think our last speaker is Zelda Walker. Is Zelda here?
Yes, Zelda is here. My name is Zelda Walker, and I work at Philadelphia International Airport. And we are essential. We cannot social distance. Not only that, we have to deal with the homeless people that's walking around in this airport. The passengers are in here eating with masks off, and we just need help. We need help bad.
Mm-hmm.
I'm kind of rushing because it's almost time for me to clock out, so I'm not going to have but a minute to do this.
That's okay. That's okay. You have another minute and 45 seconds on our clock. So if there's anything else you'd like to say.
We have to touch people. We have to touch their luggage. And and you have people that come to work that's sick, know they're sick, and they're scared to be out because they're not going to get paid. So they're spreading the virus. Literally. People come to work sick and know they're sick, but they come because they're not going to get paid, so they're spreading the virus.
Okay. Well, Zelda, I thank you for being here today. I thank you for your testimony and, for giving your perspective on these matters, because as you just mentioned, if somebody, it's part of your job to have to touch other people's luggage at a time when nobody wants to touch anybody's anything, just because of the fear of COVID. So I certainly get it. And I hear your concern, and I hear you when you say that you need help. And I think that we all are in agreement that we want to be able to provide help, and what that help looks like, is what the discussion here on the table is. So I want to thank you for being here and for, providing your very unique viewpoint on this matter. So thank you very much, Zelda.
Thank you. And I much appreciate y'all passing that bill for us, because we do need it.
Thank you. You have a great day.
You too.
All right. Madam Clerk, I don't have anyone else on my list of public comments, public commentary. Is there anyone else on the list who has signed up for public comment?
And Madam Chair, Mr. Rich Laser is on now.
Okay. Mr. Laser, I have a question for you. Before we do that, though, I do want to go back for 1 second. If you could just pause for a second, Mr. Laser. I want to go back and just ask, is there anybody else whose name was called but did not get a chance to testify? Is there anyone else? Okay. Mr. Laser, I did have a question for you, and that was regarding operations over at I believe she said the Municipal Services Building, and the protocol in terms of people entering the building, which is supposed to be closed, and the operation. So can you discuss what the protocol is, and for people entering the building, what the requirements are? Are people allowed to enter the building? Who is allowed to enter the building, and under what circumstance? Are we providing PPE for the workers and security workers who are there now? Can you talk about that in detail?
I can give you what my overall understanding of it is, and I can always circle back with public property to get if I'm missing pieces of it. But my understanding is people are reporting, we would like people that work for the city that are working in that building to work from home unless they can or otherwise have to come in to work. And we do require PPE. We do require masking in places, and the city does provide those types of supplies. Now, when it comes to folks that need to pick up permits or submit any type of paperwork to Revenue or L&I, my understanding is we are doing it by appointment only. So they have to usually have an appointment with a department to come into the concourse. But
so when they come into the building, they're required to have PPE?
Correct.
Or do we provide them with PPE if they do not have it?
I will circle. They are required. They will not be allowed in unless they have proper masking. So I will circle back with public property and the building manager there to see whether we provide it if a member of the public comes in and does not have it.
Okay, because I think before we can impart our opinions and rules and regulations on others, we certainly have to be following protocol that's going to make sure that people are safe. So I would appreciate any information that you can give us in terms of, what the protocol is, what's happening, because that's disturbing to think that we're not, sort of at the forefront of addressing this issue.
I know we require it, so I will ask public property for the protocol so I can send to you.
Okay, and we will circle back, with the appropriate parties to make sure that these are the rules that are being followed when you enter city buildings in particular.
Correct.
Okay, all right, very good. Thank you so much. I think that that completes the list of folks who were scheduled to testify.
Madam Chair, I had a question for Mr. Laser.
Yes, Chair recognizes Councilman Green.
Thank you, Madam Chair. Mr. Laser, were you able to get the information that I asked earlier?
I asked for it. I'm waiting on it to get back to me.
Okay. I just wanted to follow up from my earlier questions when you said that the administration decided to support this after the amendment, which requires 80 hours of time that's specifically, the 80 hours of paid leave that's specifically designated as sick leave. Has the administration taken a perspective on other type of leave? There have been various companies, corporations that provide paid time off, and I'm curious on the administration's perspective on that issue.
I know it has been discussed. I don't have any draft amendments in front of me, but I know there was discussion about if there was a certain amount of, because some folks don't put in buckets, as you said, they do like a lump of PTO time, and what a threshold would that, I think there was discussions about what a threshold would be in that amount to trigger a good employee or a good employer type language, but I haven't seen anything directly yet.
Okay. I guess my question, so my understanding, and I'm making sure I have a full understanding of the legislation, that under the legislation, regardless if an employer had any amount of paid time off, they would have to provide another 80 hours of sick leave on top of that. Am I correct in my understanding you're reading in the bill?
I'm sorry, you broke up on me for 1 second.
I said my understanding is that regardless of how much paid time off an employer provides, under this legislation, they would have to provide an additional 80 hours of sick leave on top of that, regardless if they did whatever amount of paid time off, they would have to provide another 80 hours of sick leave on top of that based on this legislation.
Correct. If it's not specified as sick time and they don't already give 80 hours of designated paid sick leave, that it's not designated as that, correct, they would not be considered exempt under that amendment. And they would
have a perspective of number of employers that have vacation time, sick time, or just paid time off?
I don't have an exact number. I know we've talked to groupings of different folks. Some people break it out like the city does, paid sick leave, administrative time, and vacation time. And some people do straight PTO time. Some companies have been doing specific COVID leave time that if they're giving that 80 hours would trigger the good employee exemption if they're giving specific COVID paid sick leave time. Some people have been doing that just specifically during this last year and have continued it this year. So it has varied amongst the different folks we've talked to.
So you're aware of some companies that have had paid time off, but they specifically have had some COVID leave time?
Correct.
And would that, if the company provided paid time off, but then had specific leave time, let's say it was 80 hours and they call that COVID leave.
Correct.
So let's say they provide, let's say 120, 140, 160 paid time off. But then they also designated specific leave time that they're calling COVID leave. And that amount was 80 hours or more. Would they have to provide additional 80 hours on this legislation or not?
No. They would not.
Okay.
With the amendment adopted, they would not.
Okay. Thank you, Madam Chair.
Thank you, Councilman. Are there any additional questions or comments or statements for this group from members of council? Okay, we are going to go now into our public meeting. Okay, please pause for one moment. Madam Clerk, can we have you please call the roll to take attendance? Members that are in attendance will please indicate that you are present when your name is called. Also, please say a few brief words when responding so that your image will be displayed on screen when you speak. Madam Clerk?
Councilmember Heenan.
Thank you, Madam Chair, and thank you for convening this entire day.
Councilmember O. Councilmember Gim.
Good evening. Yes, good evening, Madam Chair. Good evening, colleagues. I'm present.
Councilmember Green.
I am present.
Councilmember Thomas.
Present.
Councilmember Brooks.
Present.
And Chair Bass.
I am present. Thank you very much. At this point, we're going to have a public meeting to amend Bill number 210.
Madam Chair?
Yes.
Prior to the, I just had a question to the sponsor. Before
Certainly. Chair recognizes Councilman Green.
Thank you, Madam Chair. I just want to ask the sponsor in reference to the amendment and get some perspective on, for companies, I just want to make sure I understand this from my understanding, for companies that provided paid time off, that provide that at a level of 140 or 160 or more hours, based on my reading of the legislation, they will have to provide another 80 hours of sick leave on top of that.
So the amendment was written this way to protect workers who were being forced to use their paid time off if they got COVID. So if a company already provides the COVID pay you ask for, they don't get additional. If a company has, you're asking about PTO, right? Paid time off.
Right. So we have various companies that, like the city, others that have vacation time, sick leave. And then what Mr. Laser said, there are also some companies that are providing specific COVID leave. My question is that for those companies that provide just paid time off, and maybe they've even extended the amount of paid time off during this year because of the pandemic. Let's say they're a company that has traditionally provided 100 hours of paid time off, but because of the pandemic, they added another 40 hours to try to deal with this pandemic. But under their system, they only do paid time off. They don't have vacation time or sick leave, but they provided, like I said, additional 40 hours of paid time off on top of what they traditionally have had. And let's say their traditional is 100 hours. My understanding under this legislation, that even though they may have provided additional 40 hours of paid time off, because their system only includes paid time off, we're now saying that they have to provide another 80 hours of sick leave on top of what may be now 140 hours of paid time off.
So vacation and paid time off is not equivalent to paid sick leave. So I'm kind of confused on what you mean. So
no, and I understand it. My question is that for some, like the city of Philadelphia provides vacation and sick leave. Other organizations or companies only do paid time off. And my question is, if there's a company that, say, traditionally you get 100 hours of paid time off, and because of the pandemic, say that company's now added 40 hours to your paid time off. So now you're at 140 hours of paid time off. My understanding of this legislation would add 80 hours of sick leave on top of that 140 hours of paid time off.
Only for COVID-related paid sick leave.
Right, but I guess my question is that if that company had provided 40 hours of additional paid time off, specifically because of the pandemic, now they will have to require another 80 hours on top of that, even though they may have provided 40 hours of paid time off because of COVID. And this does not, I'm just trying to get an understanding, the thinking of certain companies do vacation and sick, and certain companies only do paid time off. And if a company has provided additional paid time off because of the pandemic. I don't get a perspective how that's incorporated in this legislation, other than they have to provide another 80 hours of sick on top of that.
They would have to still provide 80 hours of paid sick legislation.
Okay, I'm sorry.
Because you're saying, did they add 40 additional hours that were considered paid sick time, or just 40 additional hours for whatever? I haven't heard a particular situation like this, so I'm just trying to get clearly. I'm just saying, but I'm just trying to break it down.
So I'm saying, say a company has provided traditionally 100 hours of paid time off, and due to the pandemic, they decided we're going to add another 40 hours because some of our employees may get sick. So now we've added 40 hours of additional PTO because during this time period, we are concerned that people were dealing with a pandemic. We've never seen that before. So we're just going to add 40 hours of paid time off because their system is set up that they only provide paid time off. My understanding under the legislation...
I'm sorry, go ahead.
I'm saying my understanding under the legislation as it's been amended, that now, even though that company may provide an additional 40 hours of paid time off on top of what they traditionally have had to try to deal with this pandemic, they now would have to add another 80 hours of sick on top of that 40.
If this additional paid time off that they added is specifically for COVID, then they would have to only add an additional 40 paid days off to accommodate the 80 hours under this paid sick legislation. So it wouldn't be 40 plus 80, it'd be 80 total.
But I guess my question is, in the legislation says it's specifically designated as sick leave. But if a company just added 40 hours because they only deal with paid time off, because they're set up with only paid time off, but they decide to add another 40 hours of paid time off because of the pandemic, but they don't designate sick versus vacation versus paid time off. They just added another 40 hours because of the pandemic that we're dealing with. My understanding under legislation, and correct me if I'm wrong, that additional amount of hours is not taken into account. They will have to add additional 80 hours of sick leave on top of that, and the 40 hours that they may have provided cannot be adjusted, would have to be continued going forward. And I'm just trying to make sure I have a full understanding.
So, Madam Chair, could I also offer
Council?
information?
I do want to hear. I'm sorry, I do want to hear Councilwoman Brooks, because I think Councilman Green's question is really in terms of how this is categorized. Is that accurate, Councilman Green? This is really about how each individual company is categorizing time off. So some call it this, some call it that. Some give you just a blanket amount of time. Some say you have to use it for this particular use. So, Councilman Green, is that kind of where you're going with this?
Yeah. Mine is. I just want to make sure I understand under the legislation that if a company has provided 100 hours of paid time off, and they only do paid time off, and because of the pandemic, they as a company decided, no, we're going to add another 40. We're going to take administrative action. We're adding another 40 hours of paid time off because we only work with paid time off, and they're doing that based on their understanding that we are dealing with a pandemic and we may have additional needs for our employees paid time off. So they add that 40. My understanding under this legislation is that now they will have to add another 80 hours of sick time on top of that, even though they don't call that 40 hours sick leave. They just added 40 hours because they had the perspective that some of our employees may get sick. We're doing a pandemic we've never seen before. So they made the decision to add 40 hours of paid time off. They didn't call it sick leave. They just added 40 hours. And I just want to make sure I understand that 40 hours would not be counted because it's not specifically designated as sick leave, but now they have to provide another 80 hours of sick leave on top of that.
And
if administratively they created 40 hours and we added this, their requirement would be to add an additional 40 hours, which is equivalent to 80 hours. Where however they administrate, how they calculate it in their own system, they're only required that 80. So they don't have to do the 40 that they already added plus 80. They just need to add another 40 to make it 80 hours.
Point of information that may help. So thank you. So two things. under the existing city law, companies who qualify for this law must offer sick leave, right? There's a certain amount of sick leave. This was passed in 2008. There is an existing sick leave law. So all companies are required to and do have sick leave policies. Should they choose not to invest the additional time into sick leave and expand into PTO time, my understanding is that this law specifically deals with ensuring that under a COVID emergency, that employees are entitled to sick leave, that they do not have to draw down on vacation time or other types of things, or a leave in case they are pregnant, that this is set aside for sick leave. Now, if I'm incorrect about that, Councilmember Brooks, please let me know. But it is important to understand that all companies, unless they fall below the minimum of 10 employees or something like that in the city of Philadelphia, have been since 2008 required to have sick leave policy. They are required to allow their employees to qualify for sick leave within the city of Philadelphia. So if there is a conscious decision not to thus expand the sick leave under the emergency bill, which they were asked to do and did do last year until December 31st, 2020, they will be asked to do that again. Now, I think we are in a area of, I don't know of any company that has a 100-hour PTO time. I know you're using that as a faux example and just whatever. But I think we're kind of out there, so let's just keep it to the situation at hand. There is a sick leave policy. You can expand the sick leave policy. If you choose not to expand the sick leave policy, this legislation will ensure that any employee who actually gets sick does not lose time from a maternity leave, does not lose time from a paternity leave, does not lose time from an additional caring for a sick family member, or has the due time that they earned under PTO. It does ask
Councilwoman
the health pandemic that we have. I'm just finishing up. In the pandemic that we have is just to make clear there is a sick leave protection. And Councilmember Brooks, is that an accurate understanding?
Yes.
Thank you.
Okay, thank you. Councilman Green, does that answer your question?
Yes, but I just want to, and my understanding that even under 2008 law, that also contemplated both companies that had vacation and sick leave as well as PTO.
So are you asking Councilmember Green?
Right now, that was my understanding under the 08 law. It dealt with companies that do both paid sick leave and vacation time, and those that just did paid time off, and that was part of that legislation. Make sure both entities were part of it.
Councilmember Brooks, do you have a response for that, or?
To his original question, I said that if a company is classified their time and specified as 40 as paid sick time or whatever paid time off that they offer, and they're giving 40 additional hours, their obligation would be to add 40 more to make it 80 hours of paid sick leave for someone to use in the event of a COVID emergency. Not 40 plus 80, a total of 80. So that means they would have to add an additional 40.
Councilman Green?
Yeah, I understand that, but if that company did not specifically designate that increased time as sick leave based on the legislation, it would not count. And the reason I make that statement, because under the legislation, it specifically says that at least 80 hours of paid leave in 2021 that's designated specifically as sick leave, and that can be used for the same purposes under all of the conditions set forth for 2021's public health emergency leave under this chapter.
So when we wrote this amendment, we wrote it in a way to protect workers who were being forced to use their paid time off when they got sick. And this is the only way for us to protect those workers. So my answer is that those 40 hours can be extended to a total of 80 to accommodate this legislation. So we're still not asking a business to apply 40 that they were given plus another 80. We're asking them to provide 80 hours total, which means they would still only have to add an additional 40 to be in compliance.
I hear what you're saying. I won't belittle this. I mean, continue this point. It just seems there's some possible confusion on whether, if it's not specifically designated as sick leave, whether it would count or not. So I will close because I think we're getting away from the original point of the legislation.
I think also Mr. Laser has offered to provide clarification as well. Mr. Laser?
Yeah, I know Amanda Shimko is on here from my office. She can provide the clarification the councilman's looking for.
Hi, yeah. So I think it gets a little technical, but I think that, and we would be able to clear this up in regulations, but everyone in Philadelphia who has more than 10 employees has to provide 40 hours of paid sick leave right now. And while that bill allows people to classify it however they want to classify it, right? They can call it what they want. We don't actually care as long as it's what we refer to as protected time. There's a baseline assumption that every business with 50 employees is already providing those 40 hours of paid sick leave. That is protected time. It falls into that category. And so based on that, those folks who have been in compliance and should be in compliance with the 40 hours that they are required to provide will only need to provide an additional 40 hours, but they will not be able to take those 40 hours from a vacation bank that their employees also have, or from a PTO bank that their employees might also have. They aren't able to reclassify other types of leave. They have to give it in addition to if their paid sick leave program doesn't provide for the 80. And that, and you know, the council person can go into the intent, but I think I'd be remiss without saying it's so that if someone gets COVID, they don't exhaust every ounce of paid time off they have left, and they can still rely on a few more hours to get a mammogram or take their kid to the doctor or do other things that we all know continue to happen as life goes on. I hope that helps. And I do think that we can make that more clear in regulations if necessary.
Madam Chair, I also had a comment.
Chair recognizes Councilwoman Gimm.
Thank you very much. I think that first of all, Amanda, I want to say thank you. I think that helps. We were trying to make the explanation that there is an existing sick leave policy. And what this legislation tries to make clear is exactly what Amanda said, that while we appreciate the generosity of companies that seek to expand PTO, given the wide range of needs that people have, and they may see it as a flexible care kind of plan, the reality is that the majority of workers, especially those who are working part-time or who are working hourly, do not have generous policies in any way, shape, or form. And as we heard from one of the individuals, she has to work 4 months to get 8 hours. And that day can go like that, and so what we want to be careful about is not substituting, hypotheticals for what we understand the rules to be. And like we said, the council member, the council sponsor, the bill's sponsor, which we, deeply appreciate her work and the work of individuals who are in this area, has understood is that we are trying to say in a pandemic, there needs to be a set aside on paid sick leave specifically. This is not about PTO. This is about a sick leave issue when essential workers could get sick, contract COVID on the job or are forced to quarantine on the job, they should not lose other time that is desperately needed for other types of things and which they would otherwise qualify for as a result of this. So I hope that and what I appreciate from Amanda and from the Office of Labor in particular is that I think we can clarify this in regulation. I think that if there are companies that are expanding their time and it's specifically because of COVID and it is to be used for COVID, that we could figure out some way to work on it so that it becomes a little bit more clear and hopefully can accommodate the Councilman Green's concerns as well.
Madam Chair, if I could just make a comment. I want to thank Amanda for, sorry.
No, Chair recognizes Councilman Green.
Thank you, Madam Chair. I want to thank Amanda for that additional information because I appreciate the information. It definitely was helpful. And I also support the goal that Councilman Brooks is trying to address because the vast majority of people that would benefit are those who are essential workers who do not receive the benefits that they are duly should have. But I would just correct Councilman McGim's statement in reference to hypotheticals. There are a number of companies that do provide benefits, as I stated. So those were not hypotheticals that I was stating for. But I'd also support Councilmember Brooks's perspective on how we're trying to address the issue of those who are not receiving these type of COVID benefits during this pandemic. So thank you, Madam Chair.
Thank you. Are there any additional comments from members of council? Any additional concerns, questions? Okay, there being none. I want to thank all the panels and witnesses for their participation today. We value your opinions, and I want to now invite all panels and witnesses to please disconnect from the meeting before we go into our public meeting. We will now pause the proceedings briefly as multiple participants leave the hearing. So we are asking that all folks who were on the panels and who came on to testify, we are asking you now that you please drop off the call as we conduct council business in our public meeting. Okay. I want to, Councilwoman Brooks, did you have a question?
No, I didn't.
Okay, very good. I want to chair, the chair now wants to recognize Councilmember Brooks for a motion to amend Bill number 210122.
Thank you, Madam Chair. I offer an amendment to amend Bill number 210122. A copy of the amendment has been circulated to all the members of the committee, and I move that the amendment for Bill number 210122 be approved.
We need a second.
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 Okay, I want to recognize Councilman Isaiah Thomas. Offer the second. It's been moved and properly second that the amendment to Bill number 210122 be approved. All of those in favor of the motion will signify by saying aye. 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 Anyone opposed? The ayes have it. The motion carries, and the amendment to Bill number 210122 has been approved. I now want to recognize Councilmember Brooks for a motion on Bill number 210122 as amended.
Thank you, Madam Chair. I move that Bill number 210122 as amended be reported from this committee with a favorable recommendation, and further move that the rules of council be suspended to permit the first reading of this bill at our next council session.
Second.
Chair recognizes Councilwoman Gill, seconds the motion. It's been moved and properly seconded that Bill number 210122 as amended be reported from this committee with a favorable recommendation, and further move that the rules of council be suspended to permit first reading of this bill at the next session of council. All of those in favor of the motion will signify by saying aye.
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 Anyone opposed? The ayes have it. The motion carries. And bill number 210122 has been moved from committee with a favorable recommendation. This concludes the business before the Committee on Public Health and Human Services. Thank you all very much for your attendance today. Thank you.
Madam Chair, could I just make one comment?
We have officially adjourned.
Yep, I'll just make one comment. Well, I understand we're adjourned, but I just want to thank the bill sponsor and colleagues on this committee for a really engaged conversation, and just want to thank Councilmember Brooks for championing that forward.
Yes.
Good work.
Thank you. Thanks to the committee. Thanks, Councilwoman Brooks.
Madam Chair.
Councilman earlier. Thanks for everyone's participation. We appreciate our public, and we appreciate your support and activity well as members of council. Thank you, everyone. Have a great day.